Ladies and gentlemen, please take your seats. Hvala kolegama. Hvala vam, molim vas da zauzmemo mesta i da počnemo sa forumom.
Last year, we unveiled a vision.
We were not afraid to dream big. Now biotech is the logical next step.
Today, that vision is living.
Serbia recognizes the importance of science for facing big challenges. We see bioeconomy as a future of Serbia. But the government or academia nor private sector and companies can solve this problem solely. We can do it only together within the Bio4 campus.
We've illuminated a new path, and the upcoming Bio4 campus will be the heart of this revolution. Through investments, we turn dreams into reality. And growing network of partners became the engine of our successful mission. In synergy with the Center for the Fourth Industrial Revolution and the World Economic Forum. They carved the path to a new era of science and technology.
Center for the Fourth Industrial Revolution was established by the World Economic Forum and the government of Serbia. The role of the center is to provide direct support in the development of policies and legislation that help innovations develop, grow, and implement in Serbia.
With their revolutionary projects, our innovators are sculpting the tomorrow we'll live in. Alongside them, we march towards innovation. From the lab bench to global impact. Together, we shape the future.
We are creating a better and brighter future for Serbia.
Welcome to the next chapter. Welcome to the Biotech Future Forum.
I must say, many familiar faces this year. A year ago, I stood in the same place where the idea of biotechnology was born in Serbia and admired the great contribution of Serbian scientists to the world. Today, Serbian innovators are changing the world of biotechnology, creating solutions that ensure the progress of people and the economy while protecting the planet. And today, I'm witnessing the second chapter of these efforts. Good morning, ladies and gentlemen, Your Excellencies, distinguished guests, and friends from Serbia, the region, Greater Europe, and the world. My name is Vladimir Jelic, and I will guide you today through this remarkable journey of biotechnology in Serbia. At the very beginning, I have the great pleasure and honor to announce the visionary and champion of new technology, someone who has always recognized the importance of investing in the knowledge economy, creativity, and innovation. Ladies and gentlemen, please welcome the Prime Minister, Ms. Ana Brnabić.
Truly enjoying this moment.
Matthias, dear Mr. Foreman, dear Mirek, honorable ministers, your excellencies, dear partners, it is a great privilege for me to welcome you to Belgrade, Serbia, at the opening of the second Biotech Future Forum. My special gratitude in the beginning goes to the World Economic Forum and Mirek Dušek, as well as our partners in the United Nations Development Program for all of your support in organizing this conference. My special gratitude goes to my friend Matthias Korman, Secretary General of the Organization for Economic Cooperation and Development. Matthias, thank you so much for being in Belgrade today. I'm also especially grateful to our esteemed scientists from Serbia, who are now dispersed all over the globe, but who are nevertheless bridging the borders and leaving the biotech footprint of Serbia in the world. And some of them are Milica Radešić, based in Canada, Milan Mrkšić, Milenko Cicmil, Zoran Obradović, based in the US, Vladimir Brusic in China, Ana Janić in Spain, Sasha Stankovic in the UK, and many, many others. During the last year's Biotech Future Forum, we gathered in Serbia for the first time stakeholders in the field of biotechnology from all sectors of society, governments, academia, and industry. And in this way, we laid down foundations for the biotech ecosystem we are creating in Serbia today. Last year, we also set a goal for us in the government of Serbia to focus on the growth, constant improvement, and new collaborations in order to position Serbia as a biotechnology nation. It is my great pleasure to be able to share some of the results with you today, although many of you individually were instrumental in achieving them. Firstly, we set the scene with investments in strong innovation ecosystem, its most important elements being science and technology parks across Serbia in Belgrade, Novi Sad, Niš, and Čačak, which are leading the way for the growth and development of our innovation and startup community. Additionally, we prioritized investments in less visible but fundamentally important prerequisites for the growth of the high-tech ecosystem, such as the establishment of the state-of-the-art data center in the central Serbia in Kragujevac, and our platform for artificial intelligence, which is available free of charge to all of our research institutes and all of our science and technology parks. This advanced infrastructure is enabling a full control over the implementation of our digitalization strategy and is enabling database and data-driven research and development and innovations possible, putting Serbia on a fast track to bioconvergence. Digitalization of our entire healthcare system is on the top of the list of priorities of the government of Serbia. And with the draft law on health documentations and health records currently awaiting adoption by the Parliament, we are opening doors to electronic healthcare records, which will crucially improve our entire healthcare system. Moreover, we are establishing the Genetic and Biomedical Data Registry, and with this, we are joining the League of Developed Countries concerning the genomics initiatives. In the last several years, the environment we created and incentives we provided for IT companies resulted in the presence of research and development departments of major tech companies in Serbia. And our work since the last forum did the same for biotechnology. Our government, since the last forum until today, signed several MOUs, Memorandum of Understanding, with big companies such as Roche, Takeda, MSD, BGI, Swiss Rocket, AstraZeneca, Pfizer, and Frontier Biopharma. And I thank them once again for their trust in Serbia. This stream, I'm glad to say, continues even today. At the end of this day, we will have signed Memorandum of Understanding with another global biotech leader, Ginkgo Bioworks. And I thank them from the bottom of my heart for their interest in working with us. And I'm very much looking forward to meeting with them later in the day. Besides collaboration with the industry and bringing biotech giants to Serbia, the most important for us is helping and supporting our science and our scientists, with the goal to make sure that big scientific accomplishments being developed within our universities and our research institutes find their way to helping change not only Serbia, but the world for the better. Biotechnology is crucial in providing advanced solutions in various areas like medicine, agriculture, and food industry. It represents a tool that we can utilize to solve some of the biggest current global issues. Therefore, in this Biotech Future Forum, we will debate questions such as how to use bioengineering to secure healthier tomorrow, in what ways are data and artificial intelligence accelerating biotechnology's growth, and what is the potential of genetically based medicine. This forum is powered by our Bio4 campus, and you will hear how we are planning to enable the transfer of technology from science to industry in the Bio4 campus, and what is its roadmap leading from research to innovation. Serbia is very soon becoming a home of Bio4 campus, a new European biotech hub to serve global progress with multidisciplinary set of tenants, gathering more than 1,000 PhDs in more than 300 labs. And you can see the model just outside of this room. This is how our Bio4 campus will look like, and you're welcome to ask questions to our teams who will explain. And yesterday I went through detailed design of the campus, looking at each and every room individually. The minister was kind enough to show it to me, and we spent about an hour to just go through all of the labs and all of the data that we will gather in the Bio4 campus. We're planning to have within the Bio4 campus 9 scientific institutes, such as the Institute of Molecular Genetics and Genetic Engineering, Biosciences Institute, and other institutes of the Republic of Serbia, 7 faculties, including Faculty of Biology and Pharmacy, 7 core facilities, and research and development departments of companies and extensions of our already existing science and technology parks. In less than 2 months, we are starting to build 110,000 square meters of office space on approximately 20 hectares of land. Bio4 will be a central node for biotechnology and bioengineering development, and I firmly believe that together, all of us, we can contribute to the growth of science and economy worldwide. I am deeply convinced that Bio4 project will continue to change the course of our country, strengthen our economy and competitiveness, while providing the home for the most prestigious projects and technologically challenging endeavors for our industry, research community, and experts. Finally, I hope that this year's forum, with its panel discussions, extraordinary keynotes, and variety of exchanges, will set our mission for the next year. So I'm looking forward to seeing you next year back in Belgrade. I'm sure that it will provide us with new collaborations and common grounds to find the tools to follow this mission and successfully solve all tasks that are ahead of us. Once again, I would like to welcome you to Belgrade and Serbia. Welcome to the Biotech Future Forum. Thank you.
Thank you very much, Prime Minister Brnović. As we have heard, we are now already in the second chapter of the biotechnology journey, which we are all continuing together in one place, the Bio4 campus. The Serbian government partnered with the World Economic Forum 2 years ago to establish the Center for the Fourth Industrial Revolution in Serbia. Today, the center is working hand in hand with the government, businesses, and academic partners to build a strong ecosystem for biotechnology in Serbia. We are honored to have with us today the Managing Director of the World Economic Forum, Mr. Mirek Dušek. Please join us.
Dobro jutro. Good morning. Your Excellency, Prime Minister Brnabić, Secretary General Corman, ministers, distinguished guests, ladies and gentlemen, let me start my words by expressing my sincere gratitude to Prime Minister Brnabić and Your Excellency, really also for your overall commitment to the partnership with the World Economic Forum and obviously the great work that you're doing here around biotech. Also gratitude to the Center for the Fourth Industrial Revolution that we have here in Serbia. Jelena, thank you so much for having us and being here with us. Last but not least, UNDP Serbia, and Mr. Barry is here for collaborating with us overall, but for organizing the Biotech Future Forum. It is really a pleasure for me to be here with you today. Building on the success of the first edition of this forum last year, I'm confident that the critical discussions today and tomorrow will provide an excellent opportunity for increasing not only regional awareness, but also global awareness, forging new partnerships and amplifying Serbia's ongoing efforts in the field of biotechnology. Rapid advancements in biotechnology underscore the potential it has to revolutionize our lives and economies by overcoming the world's most pressing challenges in health, in sustainability, and of course in other disciplines. The use of synthetic biology, gene editing, artificial intelligence, and nanotechnology are all emerging trends that have the potential to develop new treatments, prevent diseases, create new sources of energy, and even create everyday materials leveraging bio-based processes. In particular, the use of AI, and of course this is the year of generative AI in particular, so including generative AI, has the potential to improve the accuracy and speed of diagnosis and treatment of diseases, as well as to improve the efficiency and productivity of drug development, which normally takes 12 to 18 years to reach markets, with an average cost of $2.6 billion and very low 10% success rates. Gen AI has shown great promise in accelerating and improving not only drug discovery processes, but revolutionizing biotechnology as we know it. These new alternative processes and products will help us also move away from non-renewable energy resources. For instance, in 2022, the use of a biotech fertilizer avoided 226,000 metric tons of CO2 from being released to the atmosphere, which is the equivalent of 350,000 flights from London to New York. This example, and there are many, showcases how biotechnology will continue to provide us with sustainable alternatives and how various forms of biotech will increasingly constitute a viable path to reaching our net zero objectives. Ladies and gentlemen, these are just small tokens of the large transformations that are happening all around us. And of course, they present era-defining opportunities, and you all know it, but we also, of course, need to be cognizant of all the associated risks and making sure that we also are cognizant of the impact on humanity. And for far too long, we think, at least at the World Economic Forum, we've been very good at mapping the problem. We're very good at laying out the problem and the problems and the challenges, but it's so important we really quickly move to solutions. And so just to tell you and give you a little bit of a heads up that also at the upcoming World Economic Forum in Davos in January, we will be putting a lot of emphasis on solutions. We'll do it three ways. One, really doubling down on globally inclusive dialogue, but also societally inclusive dialogue. Number two, looking at solutions, but not really simple solutions, quick fixes, but rather system-level solutions that sometimes require, frankly, quite difficult, long, painful discussions and work. And number three, of course, we need to remain categorically future-oriented. And so we believe we can at least contribute to that by also our work in January. But just to say, we think this is really important. If you are able to identify and deliver on solutions, this will enable us to build trust for what is clearly a new era. And by the way, building trust will also be the overarching theme of the annual meeting in Davos next January. If you would allow me, I'd also like to say a few words about the overall network of the Fourth Industrial Revolution that the Serbia Center for the Fourth Industrial Revolution is a valued member of. The network is the foremost global platform to help leaders anticipate exponential technologies, but also accelerate their inclusive and sustainable adoptions. We have 18 such centers around the world, across different markets, working on all kinds of solutions, but the magic, the value that this network brings is not so much what we provide, and of course we do have certain capabilities, we have very talented people and researchers, but the magic really happens in the network. So we are seeing more and more work that is happening between and among the different centers that are working together. And so when we launched the center here in Serbia 2 years ago, and we're really proud of this center, there were two firsts. One, it is the first center here in this region, but number two, it is the first center, or it was the first center that chose AI in healthcare and biotech as its focus. And so the function of the center, at least as we see it, is not only to build on the great work that you're doing here, Prime Minister and others, and building out the ecosystem of Serbia around biotech, but it's also actually to not only contribute, but to lead that work in that global network on biotech specifically. And so I'm actually proud, very proud, that we have a lot of the other centers here as well. And so we can make a small contribution also through this gathering in terms of this kind of collaboration. We aim to advance here cross-center learnings among those working on health-related issues and biotechnology more broadly, from data sharing, policy design, and integration of other advanced technologies, such as artificial intelligence. We're truly encouraged by the interest demonstrated by other governments and companies in joining our global biotech initiatives. Very recently, in June, we had the immense pleasure of having Minister Jelena Begovic, who I think is here, at the annual meeting of the New Champions that we do in China, in Tianjin. And there I met you, and then you had also a few deliberations, and there you described also what Serbia is doing, and the way you described it is building on the strong foundation of the Biosciences Institute, and then of course now with the investment in the Bio4 campus. It is clearly clear that Serbia is really a leader in this world of biodiversity, bioinformatics, biomedicine, and biotechnology, and we are really proud to be with you along that journey and support as we can. In closing, big congratulations again on this second edition of this forum. I hope you will continue it, and we are definitely ready to support you. And just to say again on the opportunities and risks, there is really a tremendous potential around frontier technologies. We at the forum are really excited about some of these opportunities, but we also are very clear-eyed about how to make sure we have the guardrails and everything that is necessary to make sure that the impact on humanity is positive. Thank you so much.
Thank you very much, Mr. Dušek. We have been working for the last 6 years to create environments and policies for the better lives of all citizens in Serbia. Therefore, we are proud to partner with the Organization for Economic Cooperation and Development on the journey. Also, we are pleased to have today with us Mr. Matthias Korman, Secretary General, Organization for Economic Cooperation and Development. Please.
Prime Minister Anna Brnabić, dear Anna, Mr. Mirek Dušek, distinguished guests, colleagues, friends all, it's a real pleasure and privilege to be here with you in Belgrade today to join you at this 2023 Biotech Future Forum. Thank you in particular to the government of the Republic of Serbia for hosting this conference in collaboration with the World Economic Forum and the United Nations Development Programme. Serbia continues to demonstrate great leadership with its commitment to harness the power and the potential of innovation and emerging technologies and to do so responsibly. And indeed my key message today, and it was touched on by the previous speaker, is let's keep innovating, let's keep making progress, solving problems and creating exciting new opportunities, but let's ensure we do so responsibly by giving ourselves the policy tools to mitigate and manage any potential downside risks, challenges and disruptions effectively. And we need to have both of those conversations in parallel, and I guess that is part of the reason why I'm here. Rapid technological advances are accelerating the potential of biotech in particular to help tackle important challenges, from facilitating more affordable access to even higher quality healthcare, to helping us improve food security and indeed sustainability. Serbia has taken an effective whole-of-government approach to biotechnology by collaborating with leaders from business, academia and civil society, which includes initiatives like the creation of the Center for the Fourth Industrial Revolution as a platform of public-private partnership in cooperation with the World Economic Forum, or the establishment of the Center for Genome Sequencing and Bioinformatics. To help build a robust biotechnology ecosystem, the government of Serbia has fostered innovation and research and provided funding and incentives to enable biotechnology industry growth, including through the Biosciences Institute founded in 2015. Biotechnology covers a set of impressive new and emerging technologies, which has made significant progress over the last 2 decades, including on the cost efficiency front. It has included, among other developments, the development of the first synthetic cell, a 1,000,000-fold drop in the cost of sequencing DNA, a 1,000-fold drop in the cost of synthesizing DNA, and the development of genome editing. Going forward, scientific developments in biotechnology could help tackle many current and future global challenges, including treating or eradicating infectious and genetic diseases, preventing food shortages, enabling sustainable manufacturing, and more effectively mitigating the impacts of climate change, among many others. Biotechnology is used in the production of synthetic human insulin to treat diabetes and for stem cell-based therapies for conditions like leukemia. One of the OECD's key strategic priorities is to help policymakers seize all of the exciting benefits and opportunities of ongoing technological transformations, while also working to better manage the associated risks, challenges and disruptions. As an organization, we play a leading role in technology governance by providing standards, policy analysis and evidence on key issues ranging from access to digital technologies to artificial intelligence to, of course, biotechnology. One key aspect of biotechnology we have focused on is synthetic biology. In our 2023 OECD Science, Technology and Innovation Outlook, we discuss preventive measures to counter risks from synthetic biology. An increasing number of individuals can, for example, assemble viruses using genome sequencing. This includes labs enhancing the infectiousness of lethal viruses through gain-of-function experiments without independent oversight. Our outlook identifies policy measures to manage the risks, including agreements among countries to prevent the sharing of high-risk results by respectable laboratories and screening of synthetic DNA orders to identify high-risk conduct. The rapid development and manufacturing of messenger RNA COVID-19 vaccines in a time of global crisis was, in fact, facilitated by synthetic biology techniques and methods. And in textiles, synthetic biology is being used to produce clothes with sustainable plant-based nylon and leather alternatives. Synthetic biology also promises to provide us with sustainable alternatives to animal or fossil-based products. For example, it can provide alternative protein sources such as plant-based meats to improve food security and reduce the environmental impact of food production. It allows for the programming of cells and editing genomes with compelling benefits in areas like health, where gene editing of insects could help to eradicate malaria, and climate change, where the scale productions of microorganisms could support carbon capture from the air. But while pursuing the opportunities these technologies offer, we do need to ensure we accompany them with policies to mitigate some of the potential associated risks and challenges. First, by ensuring policymakers have access to the expertise necessary to understand relevant technologies and follow their development. Emerging technologies like biotechnology are fundamentally challenging our basic frameworks related to our human identity, communication, and security. We cannot govern what we cannot understand. We need to ensure that there are structures in place for government to get appropriate scientific advice on rapidly evolving technologies. At the OECD, what we can offer is our platform for dialogue and cooperation, with better dialogue bringing policymakers and experts from around the world together with partners and a diversity of stakeholders to exchange and define the best and most appropriate way forward. In June, we launched the OECD Global Forum on Technology, an international venue to support a better understanding and anticipation of rapid developments in technology. It will help identify the policy tools and levers needed to ensure that these developments foster trust consistent with important shared values and principles. That forum's work will be informed by a recently established multi-stakeholder expert focus group on synthetic biology. This focus group will contribute insights and share good practices for the human-centric governance of biotechnology, with the aim of informing approaches to policy challenges and opportunities posed by the technology. Second, by ensuring responsible, values-based and rights-oriented technology development. Designing and implementing responsible technology governance is as critical as developing the technologies themselves, and it is not an easy task. Traditional means of governing science and technology are ill-suited to capture the pace and the depth at which innovations are reshaping our economies and our societies. Public trust can also be difficult to earn and to retain when information is highly technical. It is essential, therefore, that we embed values as technologies develop and are deployed, to ensure technology is consistent with open and trusted markets, pluralism, and the protection of human rights. That's why appropriate guardrails will be necessary to help build the necessary trust to optimize the benefits of their uptake while mitigating the risks and disruptions associated with new technologies. This includes standards like technical specifications for the description of biological components and high-level principles and frameworks on technology governance, such as a safe by design and sustainability criteria. The OECD supports the development of such standards and regulatory frameworks on biotechnology, for example, through our work on the harmonization of regulatory oversight in biotechnology. In July 2023, just a few months ago, we published our most recent consensus document to help regulators and safety assessors in planning and structuring environmental risk and safety assessments of biotechnology products, with a focus on the release of transgenic organisms. Third, while we cannot predict the future, we can anticipate key potential risks and ensure that our policy frameworks are flexible enough to adapt. Our 2021 OECD recommendation for agile regulatory governance to harness innovation puts forward ideas for establishing resilient and future-oriented technology regulations. Currently, we are developing an analytical framework for the anticipatory governance of emerging technologies. This framework, which we hope to launch in April next year at our next meeting of science and technology ministers, will help policymakers understand and apply technology governance approaches for emerging technologies to achieve responsible innovation. We're also using strategic foresight techniques to explore how advances in biotechnology can be mobilized to address potential existential risks and future crises, for example, monitoring and mitigating the spread of viruses. This forward-looking exercise is designed to stress test our current governance arrangements and provide insights that can lead to a safer and more secure future. In closing, the advances in biotechnology have been extraordinary in recent years, and they're very exciting. And this is likely to continue. In designing policies, it will be important to get the balance right, to ensure policy responses and regulation provide appropriate levels of certainty, stability, and security, while also facilitating further innovation and growth. This will require purposeful science, the right incentives, and responsible governance. The OECD will continue to be your trusted partner in those efforts, helping to foster dialogue, develop new ways of thinking, and provide innovative policy analysis and advice. Thank you so much again for the invitation.
Thank you very much, Mr. Korman. Many times repeated, biotechnology offers the solutions for a greener and more sustainable planet, but it must be used with a great responsibility and ethics to be a source of good. Turning the potential of biotechnology into a success story is only possible if you have trusted partners on your side who share your vision. We are grateful that the United Nations Development Program support the government's ambitious and comprehensive digital and emerging agenda, including the establishment of the Center for the Fourth Industrial Revolution. Ladies and gentlemen, we will now hear the message of the Administrator of the United Nations Development Program, Mr. Achim Steiner.
Prime Minister of Serbia, Ana Brnabić, Secretary General of the OECD, and my dear colleague Matthias Korman, Managing Director of the World Economic Forum, Mirek Dušek, Excellencies, ladies and gentlemen. It is a privilege to join the second Biotech Future Forum. It focuses on the crucial intersection between our living and non-living worlds to create new products. That is perhaps most simply illustrated in the age-old use of yeast to produce bread. Or consider the work of pioneers such as Professor Norman Borlaug, who has been called the father of the Green Revolution. He leveraged the power of biotech to create high-yield, disease-resistant crops. Helping to avert famines, he has been credited with saving 1 billion lives worldwide, more than anyone who has ever lived, perhaps. This field is now rapidly evolving. For instance, look to a range of new treatments for TB and malaria that are now in the pipeline using the power of biotech. Indeed, the importance of science to drive the future of development was underlined in the United Nations resolution on the International Decade of Sciences for Sustainable Development, notably supported by Serbia. At this moment of immense flux, I would like to highlight 3 fibers of change. First, we must recognize that biotech is far from a panacea. The same technologies that allow us to cure a disease could be used to cause one, or even manipulate humans themselves. We must then ask, how can we best contain such technologies while enabling their use? There is a vital need to ensure the ethical and responsible use of this new tech in line with human rights principles. This is amongst the challenges that are being addressed by the UNDP Accelerator Labs network. In this key area, UNDP was also proud to support the government of Serbia to establish the Center for the fourth industrial revolution. Most recently, it supported the Center to create a legal framework for biotech research that respects citizens' privacy while laying the foundations for the responsible use of artificial intelligence. This is a model that could be replicated elsewhere. Second, there is a need to ensure that everyone, everywhere, can reap the benefits of biotech. It involves supporting local communities to make new breakthroughs themselves. This is the thinking behind the biohacking laboratory established in North Macedonia with the support of UNICEF and UNDP. Bringing together scientists, entrepreneurs, and academics, the lab is now exploring how to reuse and repurpose biowaste. This aims to advance a range of environmental benefits while helping to also create new jobs. Finally, using the power of biotech to drive climate action must be a priority. That includes playing a key role in transforming the food systems of today, bolstering yields while reducing greenhouse gas emissions and the destruction of our ecological assets. Or look to new breeds of trees that could soak up carbon dioxide 1.5 times faster than normal. Projects like the Bio4 campus in Serbia, currently in development with UNDP's support, will provide cutting-edge science and research infrastructure for the next generation of biotech leaders. Or consider our Digital Health for Development Hub, a new one-stop shop to scale digital health solutions. Prime Minister Brnabić, Excellencies, ladies and gentlemen, biotech is a recognition that our living world hosts many of the answers that we need to create a greener and more sustainable planet. Yet the power of these technologies is so great that we must gain more control over them if they are to be truly a force for good, driving progress across the global goals. We must ensure ethical progress, including more consideration of future generations. In short, to ensure that this new biotech ecosystem thrives, it must start with a respect for our natural world and those living systems on which all of us need to survive. There is no doubt in my mind that the ingenuity of nature will enable us to solve problems in the 21st century that we could never have imagined in the past. Thank you.
Many thanks to Mr. Steiner for this video message and UNDP's support. We thanks once more our esteemed speakers for opening Biotech Future Forum 2023. The next panel will focus on the role of governments in promoting growth in their countries by supporting cutting-edge initiatives and biotechnology development. I would like to invite our moderator, Mr. Walter Pascarelli, advisor on tech policy, to join me on the floor along with our distinguished panelists. Dr. Jelena Begovic, Minister of Science, Technological Development and Innovation, Republic of Serbia, and His Excellency Mohammed bin Talia, Chief of Government Services of the United Arab Emirates Government. Thank you.
All right. Ladies and gentlemen, Your Excellencies, distinguished guests, I'm incredibly honored to be here with you today, with my fellow speakers on this panel to discuss this topic that is incredibly important. I think this is actually a fantastic opportunity today to be talking about the crucial role of governments, particularly when it comes to stimulating biotech innovation. The way we are going to approach this conversation is going to be in primarily 3 chapters. In the first section, we're going to look at understanding the opportunity. So what is it when we talk about biotech innovation? What's at stake here for governments in particular? We will then continue to understanding sort of the desired future that we're trying to build, and we will then close this off with sort of some of the strategies and policies that our ministers and distinguished guests here have been putting in place. Right, so Dr. Begovic, I would like to start out with really grounding our conversation into really a foundational understanding of what's at stake when we talk about biotech and government. So why should we care about this particularly today?
Okay, well, let me start with something that is very important when communicated with the public. So Biotech is with us, and innovations even in biotech for thousands of years. So it's not something from yesterday. Maybe it had a different form, but the moment that we started to interfere in nature with interfering in crops, selecting some features, animal growth and food production, we started with biotech. When we started the wine production, food production, beer, cheese, yogurt, it's already biotech. So it's something that is around us for thousands of years. Nevertheless, now we have big challenges because the technology is really developing, and it's changing the perception of biotech. So we do have a lot of challenges, but what is at stake when it comes to the government? Absolutely, we can all agree that the biotech is becoming very important economical factor. So for the government, in order to really change the economy, it has to include biotechnology. And biotechnology is a very broad field, although we always communicate about the major challenges like energy, medicine, environment protection, and food, but it's really broad. So it's about economy on one side. It's about creation of new jobs that require highly skilled people, so it influences already the education. When we talk about education, it's not only higher education, it has to start from kindergarten now, in order to really keep the minds open for the kids, for the youngs, to go towards innovations. It's about the change of the society, because we now have a biotech as a tool to improve our medical care system, to improve diagnostics, to improve prognostics, to improve the question of therapies. Then we come to pharmaceutical industry, because biotech is really becoming the first line of defense when it comes to new drug development. Vaccines, then we go towards agriculture. It's completely changing the agriculture, because we are facing huge climate changes, and they're not going definitely in a good direction. And now the biotech has to give the answers, because we have a growing population, we have a climate change, we have a problem with energy, and biotech is definitely the solution. So I can continue on and on with this, but I hope that I pictured at least a little bit how important biotech is. And at the end, last but not least, the environment protection, because we are harming the nature. Definitely with our constant economical growth, we will have discussions later on this. And then we also need a biotech just to bring us back to some kind of balance with nature.
Thank you, Minister Begovic. I think this is really a fantastic overview to ground the discussion in, first of all, understanding what is it that we're talking about. And I think crucially, it's nothing really new, but it may be the scale at which this is advancing is changing. And I think, and the next question is sort of for His Excellency, I think you've actually created a very interesting segue, keeping in mind as well what Mr. Corman and Mr. Dušek said earlier about the point about economic opportunity. And sort of, I'll be particularly keen to hear from you, His Excellency. How do you see these kinds of like emerging innovative industries really contributing to this overall economic growth that we're seeing today?
Thank you very much for this question. What I would like to start with, back last year, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and the Prime Minister of the United Arab Emirates, have launched the UAE Centennial Plan 2071. And as part of that Centennial Plan, we have 4 main pillars that this Centennial Plan focuses on. The first one is to have a future-focused government. The second is to have excellent education focusing on advanced technology and emerging technology. and then diversifying the economy to become a knowledge economy and having a happy society. As part of that, the country is working on diversifying exports and imports, and part of that is introducing focus on biotechnology. Into that, we also focus on investing in education and advanced technology and in advanced technology sector overall. That said, we in the United Arab Emirates believe that emerging technology and advanced technology sectors will contribute significantly in the overall GDP of the nation. It will introduce high-quality advanced job opportunities, and it will also introduce also the ability to attract talent from around the globe to innovate and create a better future for societies. In the UAE, we have taken steps with artificial intelligence, and those steps were early steps before governments paid that close attention to artificial intelligence by appointing a Minister of Artificial Intelligence back in 2017. And that's when no one was speaking about artificial intelligence except private sector that was expert in that area. Today we see how artificial intelligence became a point of attention to all governments around the world. And we are doing the same thing with biotech. We have started laying the foundations to start with that and introducing it within the foundations and the fabric of our economy.
Thank you, this is fascinating. Particularly when it comes to AI and sort of what your journey in there, that's something I would really like to touch upon later on, as I think this is something that is going to be incredibly valuable for our audience. Minister Begovic, one question just to follow up on that. We've talked about sort of some of the job creation, the economic opportunities that are arising. I think His Excellency has provided a very nice overview of sort of some of the strategies and policies that are in place. But I'll be curious to understand, when it comes to sort of future healthcare needs, and there we have seen sort of different kinds of changes that started, for example, from the pandemic, but new technological opportunities that started. In what ways can sort of like new applications in the biosectors help us address some of these future healthcare challenges?
Well, I would say at this moment there are two fields where biotech is really making, I would say, revolutionary changes. One is medicine, biomedicine. The other is agriculture. But I would say the biomedicine now is focused, and it's kind of logical. I mean, everyone wants a better healthcare, everyone wants to be healthy. So biotech is becoming a crucial engine of the development of medicine and even changing the aspect and perception of medicine, which is now going definitely towards precise or personalized medicine. They call it in a different way, but it's a really philosophy behind the new approach to the medicine. So during the pandemic, I think we all discovered, all of those who were not aware of the importance of science and biotech, that in those moments of fear, the biotech found a solution, and it found it in a couple of months, which is amazing. And I think that's one aspect that was a breakthrough for the humanity. We can develop, thanks to the biotech, a vaccine in a couple of months. And this is kind of, giving me a comfort that in a case of a new event, we will be really prepared, and we know that we can be prepared. So vaccines, new therapeutics, development of biologics are bringing this new aspect of medicine. So it's becoming really, it's a perceiving individual, not, it's not about statistics. Now individual human is becoming very important per se. And we are offering personalized therapies, personalized diagnostics, and personalized approach. Definitely one of the things that are becoming very important, particularly due to the pandemic event, it's the monitoring and biosecurity, biomonitoring. So now we're using biotechnology to really monitor what is happening in our cities, in our societies, in our nature. And with the application and addition and merging with AI, we're going to be able to predict what will happen in a year, in 3 months, or in 10 years. So this is also a big step forward regarding the biotech. Also, biotech is creating a huge amount of data, and data have become already new oil, really, new gold. And these data that are being created by biotech are making advances in telemedicine, in digital medicine, so we're again converging and improving our healthcare system. And there are some of the challenges that we are facing, unfortunately. Again, one is, vaccination, but the other is antibiotic resistance, which is unfortunately coming back. And it appears that, again, biotechnology will be the force that will at least contain this new emerging problem.
Thank you, this is fantastic. And I would like to follow up on that, because I think you highlight some very interesting patterns here. And I mean, on the one hand, we are talking about these so-called big macro challenges like that are taking place right now, such as, for example, antibiotic resistance, different healthcare needs, and so on. So if I understand you correctly, and that's sort of to clarify for the audience, with all this emergence of data and AI systems that we're now able to develop, this means that while the challenge is high level and macro, the emphasis is on the individual. Is that correct?
Absolutely. I think we're on a right track, at least when it comes to the medicine. It is focused on individual. But on the other hand, we have a lot of individuals, so we're collecting, again, big data, but they're very deep data, which are important if we are to face big challenges, because they're extremely complex. So you need a lot of very deep data sets for that.
Fantastic, thank you so much. Let's now shift the conversation a little bit more into sort of the policies and strategies that we're seeing taking shape today that are helping us build this future that we're just describing today. And I'll be particularly curious to hear from His Excellency what sort of, if we look at the UAE, and I'm mindful of sort of your role in innovation there, what strategies are there in place to foster, let's say, a culture, a mindset of innovation and entrepreneurship across different kinds of industries?
Well, in the UAE, we continuously work on creating a vibrant environment for innovation and entrepreneurship to thrive within the country. And we have seen in the recent years a rise in the number of startups that are starting in the United Arab Emirates. And just last year, the UAE hosted more than 200 scale-ups that altogether collectively have raised more than $5 billion, which is quite a significant number for the MENA region, and it's quite a significant jump for the United Arab Emirates itself. On top of that, we have seen also the elevation of caliber of talent that works on these startups, and also the caliber of entrepreneurs that start these. We have seen acquisitions such as Amazon acquiring Souk.com, and then we have also Uber acquiring Careem, and all of these are startups that have started within the United Arab Emirates. Now, when it comes to creating that environment, the UAE believes that, first of all, we need to attract talent and retain them and make sure that they're around. So one of these steps, the main steps that we have done last year, is we have changed our visa policy. So we have introduced the Golden Visa, which allows for talent to come and stay in the United Arab Emirates for 10 years. We have also established the freelance visa, which allows talent to come and provide their services on freelance basis, and other visas and residency programs that allows them to be in the country freely and start practicing their I would say, passion. On the other hand, we also do have, the country has been working on attracting venture VCs from around the world. So we look at private VCs, we look at also government-led VCs that could be hosted in the United Arab Emirates to support that ecosystem. And we have succeeded at attracting one of the big VCs, a lot of the big VCs to be part of this ecosystem. On top of that, we are also putting in policies and guidelines to support also corporate-led investment in startups. Other than that, we also have in different emirates in the UAE, we have established incubators to host these startups, to allow them to come and start and thrive in the country. We have incubators such as N5 in Dubai. We have Hub 71 in Abu Dhabi that have been hosting successful startups that have scaled up and have raised funds to go out from the UAE to the region and globally. More than that, we have also free zones that host different clusters of industries. So for example, we have free zones that focus on biotech, free zones that focus on media, free zones that focus on technology, including artificial intelligence, and these free zones also support that kind of encouraging innovation in those sectors and industries. Finally, I would just like to speak about the university effort and the academia effort in innovation. We have our top 5 universities that have research labs and research centers that focus on different sectors in the advanced technology, and also supports encouraging the innovation and startup mindset within the students in there. Thank you.
Thank you. This is fascinating, and I think it's really interesting what you mentioned, in particular also this sort of some of the companies, like I remember Kareem becoming the first unicorn in the region a couple of years ago, now being acquired by a major corporation. And when I hear some of the points you say, like for example, students, researchers, ultimately the people that developing these companies, in addition to VC and funding, it ultimately sounds like the major asset here is talent. Is that correct?
Yes, that's correct. Absolutely. And this is what we are betting on in the United Arab Emirates.
Fantastic. So let's look a little bit more at sort of some of the international collaboration. And I think it's actually quite nice that we're here today because we have many stakeholders from different kinds of, from countries, from different kinds of organization. And Minister Begovic, I'll be interested to hear from you. And sort of when we talk about collaboration and sort of international engagement, and I think, well, as I said, this is the best forum to discuss this. How do you see, what's the importance of that when we're trying to stimulate a biotech environment that is sustainable, that is effective, and that produces innovative solutions?
I mean, when it comes to the science, it's all about collaboration. When it comes to the biotech, absolutely, it requires collaboration, and I would say on different levels, even on governmental levels, particularly with the emphasis on legal framework and ethical framework and alignment of these legal, I would say, documents. So we have different solutions in different regions and in different countries, but if we want to biotech and biotech products and services, you know, to flow like a water, we need a clear passage for them. So this is important, I would say, for the communication and collaboration on a governmental level. When it comes to the scientists, I mean, it's a part of regular activities to collaborate, because I can give an example of Serbia. So it's a small country and it's a small market, a lot of talents, but we need global solutions. That means we have to be on board on a global level. We have to exchange the knowledge, we have to exchange the experience, and we have to work really together, because when it comes to global challenges, you know, it's about numbers. The more ideas you have, the more solutions you offer, you will find easier the final solution, at least for that moment. So the collaboration is definitely crucial, and the flow of knowledge, but also the flow of biotech products, it's a kind of challenging, and this should be discussed really on a higher international level.
Fantastic. One of the themes as well, like latching precisely into this, that has been mentioned repeatedly, and that I'm confident will be mentioned many, many more times today, is the topic of funding. So I might be someone, a talented researcher, as described, for example, by His Excellency, and I have a great idea, a great team, something in mind that could be really revolutionary. What sort of mechanisms do you find are effective or are in place precisely for funding such kinds of ventures that are in development?
Yes, well, Serbia was really successful in recent years in ICT. So a lot of startups, a lot of very successful startups. And now we made a next logical step, and that's a biotech. It's much more expensive. It's really time-consuming, and you can really multiply everything at least by 10, including the investments, the time, and the risk. So it requires a different approach. It's not easy, but it's doable. So in Serbia, we have 2 national funds that are funding. Science Fund is more focused on the research and science, and Innovation Fund that is focused on funding the private sector, the startup community, and the collaboration between academia and the private sector. We're also part of European Horizon Europe framework, the biggest funding mechanism in the world at the moment, which is also focused on innovations. So we are contributing, like every European country, and between 30 and 40 million euros a year, our institutions and private sector is getting money and funding from this fund. So we are developing mechanism, particularly through the Innovation Fund, and the fund is really evolving. So it's following and listening what is happening within the startup ecosystem. And last year, the government was willing to take the risk in funding startup ecosystem. So 2 VC funds were established here in Serbia. The government is also working a lot to attract different investors, VC funds, and mechanisms to focus on biotech. But biotech is really risky, really expensive, but at the end of the journey, it's offering the solutions, and the unicorns from biotech are really unicorns. So it's a challenge, but the government of Republic of Serbia decided we're going that way.
Fantastic. And I mean, I do remember actually earlier in the opening remarks by Mr. Dušić, there was sort of this number that I thought was quite interesting. 10% of sort of like drug discovery, it's like a fraction of sort of like the endeavors that are actually put in place that are actually successful. But what helps there is, as was mentioned earlier, is artificial intelligence. And here I'll be very curious to hear from His Excellency, because I remember when I started working in AI policy back in 2016-17, while everyone had sort of, there was a discussion about, you know, the startups in Silicon Valley, when it came to the policy development, there was one country that was actually really much at the avant-garde, and that was the UAE. Later on, when I worked on a tool called the AI Index, the UAE was always #1 in the region and has remained there firmly without any kinds of changes. I'll be really curious to hear from you. Can you describe a bit sort of like your journey in sort of working towards AI excellence? What are sort of like the parallels that we can build towards other kind of industries such as biotech?
Mentioning AI, just recently the Minister of Artificial Intelligence in the UAE was named in the Time magazine amongst the top 100 influencers in artificial intelligence globally. This honestly reflects the vision of our leadership then when His Highness decided to appoint a Minister of Artificial Intelligence at an early stage as an early adopter. So if you'd allow me to highlight some key factors that allowed us to actually accelerate in artificial intelligence when it comes to the government, the main one, and I would say the foundation, is having the vision from and the support from the leadership for adopting such advanced technology at an early stage. Obviously, this demonstrates a commitment from the government towards all of these sectors, be it government or private sector or semi-government, that the UAE wants to be a leader in artificial intelligence, and I believe that such thing also applies in biotech and any other advanced technology sectors. The other part that the UAE worked on at an early stage is having a regulatory framework around artificial intelligence and other also advanced technology. So I would say that we worked at early stages to design policies and regulations around artificial intelligence. We also worked on designing guides to the society, whether it being the government or even the private sector or experts in the United Arab Emirates around different elements of artificial intelligence. So I'll give you an example. We have a guide on deepfake to give government employees an understanding of what is the meaning of deepfake and how artificial intelligence could be used in a negative way, and how can we counter that and make it a positive outcome for the nation. On the other hand, the UAE have established a regulatory lab. This regulatory lab allows us as a government to implement advanced technology within government without the need for any laws or regulation. And this regulatory lab allows us to be agile and flexible with trying new things without the need to change policies or regulations, test it for 6 months up to 1 year, and if it proves success, then we amend it in laws and regulations. And this helped us a lot in experimenting with artificial intelligence, specifically in facial biometrics and using it for digital identity. It was not part of the law, and it was established in the regulatory lab for 6 months, and after experimenting with it, that helped us then add it into the law. I would say these policies and regulations also could be established in the biotech industry and would help us also realize the benefit of different implementations in the biotech industry in government level and in other sectors. Of course, over the years we have worked on collaborating with talents around the world in the area of AI, and this is what we're doing right now in the biotech industry, specifically in the genome program that we have in the United Arab Emirates. We have recently launched the genome strategy, and in the genome strategy, one of the main pillars is collaborations with experts around the world in that area, and collaboration with academia. We have research centers in the UAE that work also on collaborating with other universities around the world in the area of biotech. In general, we worked in the AI implementation on promoting adoption in all sectors, including government. And this is what we are doing also today in the biotech. We promote it in the government sector. We promote it also in the procurement process of government to support that sector to grow in the country.
Fantastic, thank you so much. Well, clearly with everything that's been going on, especially I think this year was kind of like the year where the impacts of AI, I think, were felt perhaps a stronger way than maybe in any other years. And I think it sounds like it definitely paid off, all the foresight and strategy that you implemented in advance. Well, ladies and gentlemen, I'm afraid we're out of time, but this has really been a fantastic discussion. I look forward to continuing the conversation with you off stage. And thank you so much for joining us. Ladies and gentlemen, please thank our speakers.
Thank you.
Thank you to our speakers, to Ms. Begovic and Mr. Bin Talia. Next panel is investing in biotech innovation for discoveries. How can we support the translation of innovations into concrete strategies? What is the experience in this area? Mr. Pascarelli is still with us on the stage, but I'm kindly asking Dr. Ivan Rakonjac, Managing Director of the Innovation Fund of Serbia, and Dr. Ami Appelbaum, Chief Innovation Scientist at the Ministry of Innovation, Science and Technology, and the Chairman of the Board of Israel Innovation Authority, to come to the stage and join Mr. Pascarelli. Thank you.
Is this working? Oh, perfect. Tone on. Wonderful. So I think the previous conversation was really fantastic in that it helped us really understand the strategy, the policies that are in place to develop a biotech infrastructure that is sustainable and innovative. And I think for this part of the conversation, what's really great is that we can almost tackle it from a different kind of angle. So we have here innovation directors who have been working at the forefront of the technology, who have both the technical understanding, but also the one from sort of the more the operational point of view that I think is going to be really fantastic. And so I want to start this conversation again really grounding our understanding of biotech and again understanding what it is that we're talking about here. And here, Dr. Appelbaum, I would like to start with you. So is it fair to sort of understand biotech is sort of this convergence of biology and technology, but what exactly are we talking about when we mean biotech?
So, good morning for everyone. It's great to be here. And what we've been experienced in the past, I would say, 10 years, in accelerated terms, is that the field of biology is making tremendous progress, especially in the biotech, especially on the genomic and this genomic sequencing, understanding the whole biome. And in parallel, I would say almost independent, the engineering side of data collecting, artificial intelligence, generative AI is progressing at the fastest pace, and it's accelerating and not decelerating. So now, if you look on both fields, they're running really, really fast. I would argue the fastest since human beings exist on this globe is, and it's accelerating. They started really fast and continue to accelerate. If you put now together the biology on one hand and the data scientists and artificial intelligence and generative AI, we are not far from the point that you will be able to put the two together and test drug on a chip for a personal cells or a personal liver disease on a chip, and you can shorten the time it takes to see the testing of a drug by order of magnitude, if not more. So, and what we saw is that the COVID has really changed the game, because all of a sudden, everyone on Earth, and I would say science and biotechnology and biological convergence with engineering saved the globe, saved the human race on this globe. So all of that is just moving forward at ever faster speed.
Fantastic. And I think this highlights precisely the point that Minister Begovic was making earlier, the fact that, well, biology has always existed, so has technology as well, but now what we're seeing is almost like a convergence of different kinds of categories and factors that together are accelerating sort of the biotech ecosystem in a much faster way. And let's look at sort of like the grand theme. And I mean, usually, for example, for comparison with AI, the promise there is that there's sort of this idea of productivity and efficiency, perhaps a better life quality, accelerating things. These are sort of some of the core components that I think about with artificial intelligence. When it comes to biotech, I'll be particularly curious to hear from you, Dr. Rakinchak. For governments, there's sort of this understanding that, well, we can deliver better healthcare, we can produce better services for our citizens. From your perspective as the MD of the Innovation Fund of Serbia, what sort of the innovation, the opportunity that some of your stakeholders are feeling there? What's your feeling there?
Yeah, first of all, thank you very much for the invitation for this panel. It is my pleasure to be in this distinguished company. Well, as Minister Begovic said in the previous panel, there are lots of opportunities regarding the biotech, and what we actually try to do here in Serbia is to boost biotech on a lot of levels. Because unlike the investing in innovation in a sense of, let's say, general startups or information technologies, which Minister Begovic again mentioned in the previous panel, with the biotech is much more time-consuming, fund-consuming, and obviously you need even more people, lots of more networking, cooperation. So in that sense, we have, as we all see, Bio4, one of the major drivers in the sense of infrastructure. But then again, from the point of view of the Innovation Fund, of funding the endeavors or the innovation projects, that's something that we, as Minister said, kind of adopted from the, let's say, supporting the general startups, information technologies. We've seen that there are lots of, let's say, challenges in funding biotech. And what we've done, we put through all our programs, like general programs for support from the very early stages of development up to investing with venture capital funds. Minister mentioned that last year we got 2 venture capital funds, but what we've done afterwards, this year we published a call for Serbia Ventures just for biotech. And now we are in the process of evaluating applications. So in a couple of weeks, we are going to invest in one of 6 future VCs, but just for the biotech sector. So that's something that we basically prepared as one of the most important mechanisms to support development of biotech and incentivizing the venture capital funds willing to invest in the venture capital because, as you know, return on investment and the time which is necessary for the whole operations of development of biotech, unlike with the information technologies, it takes lots of resources.
Fantastic. I think this is really, really useful. Dr. Applebaum, I have a question for you here, just to follow up. And I'm really glad because as a chief innovation scientist, we can actually go a little bit deeper into sort of understanding the technologies that we're talking about. And I'm mindful that the majority of our audience, to the best of my knowledge, are not biologists, but could we maybe pick one or two sort of areas or applications that you think are really promising? Because there's been discussions about mRNA vaccine, DNA sequencing, genomic combination with data and AI processing. Can we pick one or two and sort of like provide a simple explanation of sort of what they are and why you're most excited about those?
Yes, sure, but I would like to take this opportunity, and the Prime Minister is still here, and say that in my mind, the most important element of government is to create an enabling ecosystem. And if we have time, I will be happy to go into this enabling ecosystem. Because if we put effort just on startups, and we forget regulation, and we forget large company, it may not work. So later on, I'm sure we'll go into all this discussion of the strategic for the countries, and what, to your point, what it can bring to the country. So from Israel Innovation Authority, we would like to bring economical value to the country and economical value to the world. And bring value, for example, we know that we have a very dire situation of global warming, right? So maybe some plant and some food that we used to grow in certain temperature and certain humidity, now the temperature and humidity will not be the same in that country. So by changing the genetic, and I know changing plant genetic is something not acceptable in Europe, but in other countries it does, and depend what type of change genome. You can make the plant more resistant, like a beans or like rice, more resistant to high temperature, to salty water. So the whole agriculture, at the same time, we are talking extensively and investing extensively in artificial meat and in protein that is not coming from the cattle and from live animals, but coming in the lab. So if you go and now can produce a similar type of fish or steak or shrimp in the lab, instead of exhausting all the fishes in the oceans, or instead of creating the pollution that the cattle and the dairy farm is creating, and the demand of food is expanding, and United Arab Emirates know it's very well, basically it's a desert, but they want to be independent of food supply and secure. How would they do that? So those are the two areas other on the health tech. The last point I think that we can really see coming fast than any other area is that the doctor will not just listen to you and say, oh, you have a headache or you have some disease like this and that. So I think, typically they think, because they don't have a hard data, to diagnose you and to give you the right medicine, they will be able to use huge amount of data. And here I call for the World Economic Forum, for the OECD, make all the available effort to make a huge database, global database, I would say. Then the doctor, in a matter of seconds, can see all those people who have a similar disease, similar genome, similar, which is different from similar medicine that they got, what was the result, and what he should provide the patient, but not from just guessing and thinking based on instinct, but based on data. Again, at the end of the day, the machine are not going to take over the doctors, but the machine will provide tools that will enable the doctor to make his decision on much more educated, data-driven, and again, each heavily dependent on the huge data, on computerized, and the most important, regulation. We do not want to compromise our privacy. We do not want to compromise any of the freedom that we enjoy today. We want to stay free countries. We want to stay that not the big brother will look at us, but at the same time, there is a lot of value. And I think that conference is a great opportunity to call everyone for the task.
Fantastic, thank you. And I think you've kind of made the segue already now into the next section, which I'm very grateful for. And we've now, I think, really established in an unmistakable way, I think, what's at stake here, what's the importance. Now let's talk about how we can make it happen. And I think Dr. Appelbaum has already kind of alluded to that, but Dr. Rakonjak, this is a question to you now. When it comes to sort of what's needed for the ecosystem, from what you see from your perspective, what is needed to stimulate the biotech sector, for example, how do you feel regulation can help you? How can things be made easier for you and sort of the people that you help with from your point of view?
Yeah. Well, to be perfectly honest, if you ask me that question like 7 or 8 years ago when I joined the Innovation Fund, I would be struggling to answer to that question. But now, luckily, well, my bosses are here looking at me, so I don't want to think that I have easy job, but it's much more easier today than was it like before 7 or 8 years ago. Back then, the Innovation Fund always had to explain to the government, to the ministry, to the population, like what we are doing and why are we, giving away money to the startups, to the private sector, etc., etc., etc. So, but maybe more than ever now we have very fast development of technology, much faster than, let's say, society can follow, in a sense of legislative, in the sense of security as well, maybe even in a sense of market and the adoption by people. So in that sense, you always tend to have some gaps. And those gaps can be used for good or for worse. So in the sense of providing legal framework, in the sense of providing, a security framework, that's something that not just, any state, any national state, but we had our speakers in the first session, they all spoke about the necessity of regulating and, let's say, arranging that space. Now I'm sitting with the ambassador of Japan, and if I'm not mistaken, several years ago they adopted this strategy for the Society 5.0. Now we have a Center for Industry 4.0 or 4.0. It's basically about society. So technology can be merely a tool for the best or for worse. That is the question. We, at the Innovation Fund, we are trying to leverage all the possibilities for the good, and we are basically supporting the startups, the small and medium businesses, and the collaborative grant scheme between the academia and the small businesses as well, for the best, hopefully. And what I mentioned in my previous session, even with the Serbia Ventures program, we didn't want, as a part of the government, as the part of the public space, we didn't want to interfere too much in the market. So we didn't say, okay, like, we are going to govern all of those processes. Obviously, in the very early stages of development, we support projects when nobody else would. I mean, you couldn't get funds from the bank in very early stage, obviously, nor the venture capitalist would be interested without traction, obviously, to invest. However, we said, okay, let's co-invest with the venture capital funds. We don't want to be a fund manager. We don't want to manage funds. We just want to put our money where the money of private investors are. So we are per Serbian Venture Capital Fund established here in Serbia, obviously. We invest up to 5 million euros and the funds are around 20-25 million. So in that sense, we are leveraging what we have as a regulatory framework, law on alternative investment funds, etc., etc.
Brilliant, thank you so much. We're slowly running out of time, but I wanted to give Dr. Applebaum the opportunity to just mention one final point, just because we have here so many high-level stakeholders with us. If there's sort of one recommendation as an innovation director that you can give policymakers on how they can foster a biotech sector that is advancing fast, but simultaneously maintains ethical standards and principles, what would that one recommendation be?
One recommendation is that looking at the innovation and looking at the role of government and private sector, my recommendation is to let the private sector to drive and government to get in where there is a market failure. What is market failure? Market failure is if I come with a great idea that will change the world, and I go to VC, he will say, what are you dreaming about? What are you talking about? You have no proof, you have no team, you have no market. That's where the government needs to come in, assess those changing the world's ideas, and go and create the opportunity for that inventors to prosper and attract the VCs. Yesterday, I had a big opportunity to go and see the museum of Nikola Tesla. If any of you did not go there, I highly recommend. What you see is inventor that had idea that shocked the world. No one agreed to even listen to him. And since it was different time, in the different century, he had to move to America and pursue all of his ideas there. The task of each government, and again, I'm looking for the Prime Minister to the right, the task is that those innovators with the innovation organization will stay here, will be able to prosper in the same country. It's not a big deal to bring money from the US to Serbia, or for that matter, to Israel. Israel got, in 2021, $27 billion invested. $27 billion invested in Israeli high-tech in 2021, most of it from the US. Enable those entrepreneurs to stay in the homeland, to stay in the country, to grow the company in the country, and to make economical impact. So that's my one idea. Make sure, create ecosystem that any entrepreneur, as crazy idea as he had, he can prosper in his home country and grow for the better of all humankind on earth.
Fantastic. Wonderful. I'm afraid we're out of time. I would like to thank the Prime Minister as well as the organizing team for having me and the rest of the speakers here today. Let's continue the discussion off the stage. I think there's plenty more thoughts that we have to share. So thank you so much for joining, and I look forward to seeing you very soon. Thank you.
So we are here, and I can freely say that a lot of people would like to take a photo in front of the main conference hall, but they will join us. Ladies and gentlemen, we'll now hear an inspiring talk by Professor Timothy Lu, professor at Massachusetts Institute of Technology, MIT, and co-founder and CEO Senti Biosciences US. Timothy Lu earned his MD from Harvard Medical School and his PhD in electrical and biomedical engineering from Massachusetts Institute of Technology. Since 2010, Dr. Lu has been an MIT faculty member in the departments of biological engineering and electrical engineering and computer science. He served as CEO of Senti since its co-founding in 2016. Dr. Lu has extensive experience in the field of synthetic biology and has been a co-founder to a number of biotechnology and biopharmaceuticals companies. Dr. Lu, please join me on the stage. The stage is yours. Thank you very much.
Okay, appreciate the opportunity to be here today. First time here. I'm really excited about the conference and the focus on biotechnology and synthetic biology. So just as an introduction, so I was originally a computer scientist by training, but I was in Boston around the time of the Human Genome Project. And what was really exciting around that time, this is over 20 years ago, was the idea that biology could become increasingly digitized, that we would understand how to read and write DNA, and by doing so, be able to sort of uncover how biology works, number one, but two, how to engineer biology. So that's really been the focus of my own internal research, and I think it's a really exciting area of growth and scientific advancements for this century, actually. A lot of what's driven this progress is underlying technological drivers of DNA sequencing and synthesis. So I'm sure many of you are familiar with, so-called Moore's law that's driven exponential improvements in semiconductor technology, allowing us to take, huge computers to put these computing power into our phones. That's really been driven by the fact that we can double the number of computing power every year and a half on our phones. In DNA synthesis and sequencing, you've seen similar trends where we've seen exponential improvements in the scale and the cost of being able to both read DNA and write DNA. And what I'm hopefully going to share with you today is that's opening up a lot of opportunities for us to better understand the living world around us, number one, but two, how to engineer that world. And so the simple idea is, we've moved from a time when our view of biology and our ability to manipulate the DNA inside of biology was very traditional, cut and paste. We'd have to spend years in the lab to just take one gene out and put it somewhere else. Where now we can go in and really program all of the specific A, T, Gs, and Cs that go into a given biological construct. This is very loud, so I'll try to speak up, prevent the echoes here. For drug discovery, I think that gives us a lot of opportunities in the future to transform the way we discover drugs and develop drugs, moving from simply screening and sort of searching for drugs that have some effect to actually purposefully trying to design and create new therapeutics, ones that can be rationally controlled and programmed to be much more precise. So what I'm going to tell you today are 3 brief stories around where we think this technology can be applicable. For number one, uncovering the disease networks that underlie why we get diseases like cancer, autoimmune disease, or others. Number two, on the right later, I'll talk about how we can actually engineer cells, living cells, as drugs using this sort of synthetic biology technology. One of the central things I mentioned that got me excited personally about this field, and I think something that's really a core theme for the future. Yeah, yes. Sure. Oh, okay. It was echoing in my mind here. Got it, okay. Sorry if this is too loud here. So one of the core things that I said that is quite important, got me personally very excited about this space, is trying to connect how the genotype, so the genes that are inside of our bodies, influence phenotype, right? So why does the DNA that we have lead us to look a certain way, grow a certain height, have certain diseases? That linkage is something that's still generally not very well understood. But with the power of being able to sequence our genome, the power of being able to characterize the proteins, the DNA, the RNA inside of our cells, we're making great steps to try to understand what drives biology and what drives disease. So this is still the major challenge that the entire field is really working towards, is try to understand what causes disease and then how can we fix it. So there are several ways in which people are taking to try to understand this sort of approach. One is to be able to screen and map disease causes, right? So can we look at all of the cells that are in the body? Can we look at all the cells in the brain? Can we look at the genes inside of our cells? And number one, just create an understanding of what's there. So a lot of work in the last several decades has been trying to map out simply what is present. Two is then we need to understand how is that linking with disease, right? So why is it that certain genes, when they change our likelihood to get cancer or Alzheimer's disease or other things like that. Number three, if we have an understanding of what is causing those diseases, we can potentially create much more precise therapies. So we can create drugs that go in and try to fix those problems very directly. And four, hopefully we hope this can drive better impacts for patients in the future. However, this is a really challenging problem. So if you look inside of a cell, a human body, every cell has maybe 30,000 genes. It's not so simple that one gene controls one thing. There's no single gene that controls how tall you grow, or no single gene that controls whether you're going to get cancer or not. In fact, all of these genes, you can think about that picture on the right, are influencing each other. They're making products that turn on or off 10 other things, or they might bump into 50 other proteins inside of the cell. So the number of interactions that take place inside of the cell are very vast and very poorly understood. This is not how you would design a supercomputer or a chip, right? The way we design things inside of our phone is very rational. We connect things physically and we know what the map is. But the problem with biology is we don't actually know what that map looks like. And so oftentimes, if you even take a very small snippet of that complex network on the right and look at it on the left-hand side here, you'll find that many of these connections are there. And it's the case that if you modify one thing, it might affect another thing, and this sort of is a complex web to try to uncover. In general, less than 1% of all the possible combinations or interactions have really been fully explored and exploited from a therapeutic perspective. And so most of science traditionally has been very reductionist. Let's take this gigantic network. It's too complicated for me to understand. So let me just focus on like one gene and see if I can figure out what that one gene does. And then once I figure that out, then I start thinking, okay, what's around that gene? Let's try to figure out everything around it. And then hopefully one day I'll figure out the hundreds of millions or trillions of potential interactions that are going on inside the cell. So that's really a whole universe of things that is not fully understood or exploited. One of the things that we've been doing and the field has been doing is trying to use this newfound area of CRISPR technology to try to understand these networks. So actually, let me go back here. One of the ways in which we understand how the cell works is we take the cell, when we knock out a gene, we remove a gene and we see what happens. Did we break the system in some way or did we change the system in one way? And over the last decade or so, the development of technologies like CRISPR so that we can easily go in, remove whatever gene we want and see what happens has really given us a significant improvement in terms of starting to understand these networks. But still, the traditional approach has been, let's just target one gene at a time. Let's knock out gene A, then see what happens, knock out gene B, see what happens, knock out gene C, and see what happens. And I would argue that where we need to move towards in the future is really looking at combinations together. And so there's been now, I think, I'm showing an example here from the work that we did at MIT, but a lot of other groups have also now adopted this technology where we can go in and manipulate 2, 3, 4 genes at once and actually do this in very, very high throughput. You can synthesize a large library of these gene knockouts and actually characterize the effect of each one of those. What that allows you to do is to start taking this network and instead of just looking at one small corner of the cell map, to look at the entire map or a much broader picture of the map. And I think our dream as biologists or as a field is ultimately to understand everything that's going on here, even though we're starting from maybe a small corner of this potential universe. Now, as you can imagine, one of the challenges when you do this is you generate a tremendous amount of data, right? So as I go in and I make a million different changes inside of the cell and I want to see what happens and I collect a million data points, is it ever possible for a human to sit down and actually understand now and sort of decipher what's going on? And clearly the answer is probably not the case. And so I think this is an interesting area where this combination of doing this sort of high throughput biological mapping is now coming in really close contact with advances that are being made in data science, in machine learning and approaches like that to actually take the data that we're generating and make sense of what's actually happening behind the scenes. So there's a lot of active work ongoing now in the field to try to leverage some of these unbiased machine learning strategies to uncover patterns or laws empirical laws that govern what the cell is doing. So as we collect data on what genes are doing, proteins are doing, metabolites are doing, there's so many layers of what the cell is doing inside of the body, we can increasingly train algorithms to try to predict what happens if I go in and I modulate this pathway. What's the biological phenotype that I'm going to get? And I would argue there's still a long ways to go with this. We're really in the beginning days of applying sort of this large-scale data science machine learning to the field. Number one of the key challenges is how do we ensure that that data quality is very, very high? So designing the proper assays and quality control so that you're ensuring that the data you're collecting is useful. And two is also synchronizing that data generation across many, many groups, right? It's unlikely that any single company, any single research team is going to generate all the possible data you need. This is likely something that's going to require, nationwide or international-wide collaborations to really come together and share data in a way that's meaningful. And so setting out what the standards are and the quality control measures to make sure that data is high quality from the beginning is a really core part of the field that we need. Second area that's really challenging is like a black box. Like a lot of the machine learning methods that we're using right now to understand biological systems don't actually tell us why it works a certain way. It can give us good prediction, but it doesn't actually teach us something deeper underneath the biology. And so I think that's an area of active research where people want to take these predictions that are being made, but increasingly understand why they actually happen and translate that back into biological understanding. We do need ever higher throughput experimental strategies to do this work so that we can continue to lower the cost of collecting these large data sets and increase the speed and scale of learning. Fortunately, that last box on the right, because there's so much active AI work going around across the world in non-biological areas, we can leverage a lot of those same infrastructure, those same computing strategies to really accelerate these workflows. But that being said, I think this allows us potentially to set up a very virtuous loop. I think you'll probably hear about this from a lot of people who are in the synthetic biology space, that the idea that as we collect more data, we can increasingly compute and train models to then understand how this data how this data can be used to predict what happens to biology. We can confirm these with biological experimentation, and using this virtual cycle, improve our general ability to understand and manipulate biology. So I'll give you an example of this in a little bit about where we're using this for cancer therapeutics specifically. But this sort of design, build, test philosophy, I think, is ingrained into where this field is going as we gain greater ability to manipulate and understand our field. So one of the areas where I think this has an immediate term impact is really on creating more precise therapeutics for a variety of diseases. One area in which this is already making a huge impact, clinically speaking, today, is in the discovery of biomarkers for cancer drugs. So if I'm a patient who unfortunately develops cancer and I go in to try to figure out what's my best treatment paradigm, depending on what is causing that cancer, what are the key genetic changes that have resulted in cancer, I might receive a different drug, right? And so to make that connection, though, I need to do several things. I need to be able to collect my cancer. I need to be able to sequence it or characterize it in some way to see what is different about that cancer versus other people's cancer. And then I need to be able to go into a database of information to say, based on what genetic changes are there, what drug is most likely to treat my disease. The nice thing about this from a clinical perspective these days is there have been examples already of approved drugs that are blockbuster on the market, changing people's lives, where the presence of a biomarker has significantly increased the chance that the patient will actually respond to the drug. That's certainly a welcome thing for the patients themselves, but also very helpful in the drug development process, where you can design trials that are much more focused, more efficient, more likely to succeed. And in general, in the presence of biomarkers, if they work, you can get about a 10x improvement in the probability of success with some of these approaches. So one of the areas in which, just to show this a little bit in more detail, this is being applied to, is to discover biomarkers that give cancer cells a unique vulnerability that we can attack. So here's an example where, let's say we have a drug here in the middle that we're putting into the body, and we want that drug to kill cancer cells, but we don't want it to kill healthy cells. That's like the central problem in oncology treatment, right? How do we kill cancer? How do we not kill healthy cells? And what we're looking for are essentially what we call biomarkers, where a change in that cancer cell, in that upper right-hand corner, a change in the gene or a knockout of that gene, which is present in cancer but not present in humans, creates what we call a synthetic vulnerability, where you can target these cells in a way that only kills the cancer cell and only spares the normal cell. So it turns out there's actually many possible biomarkers that one could explore. Over 3,000 genes that are present in the body have a prevalence of greater than 5% in cancer databases across the world, right? So all of these could potentially become, on their own or together, biomarkers for predicting whether is diseased or not, sort of susceptible to treatment or not. However, only a very small number of these genes have an associated approved precision medicine drug today, I think. So this is a really interesting opportunity. And so using the approaches that I described earlier, we now have the ability to rapidly go through, and actually, what we do is we basically go through and knock out and manipulate large numbers of genes. We go in and knock out every single potential gene inside of a cancer cell, and we look at what targets does that allow you to go after. And we're also creating combinations of these biomarkers, where you can say, maybe it's not just a single gene that gives you a vulnerability, but if you have these 2 biomarkers together or 3 biomarkers together, that creates something very unique and susceptible. So this is an example of this. These are just one piece of data that I'm showing you here. On the left, this is an FDA-approved biomarker for existing oncology drugs. There's a class of drugs called the PARP inhibitors, a very large class of very effective drugs for patients that have certain types of ovarian cancers or breast cancers, where the presence of this particular gene, CDK12, if it's essentially mutated in this sort of context, you increase the sensitivity of the drug by about 12 to 17-fold. So with the biomarkers, it's in red, and that's basically the ability to kill these cancer cells, shown here on this graph. And essentially, if you have this particular mutation, your cells are 10 times more likely to be killed by this drug. Using this sort of strategy, this company Engine, but also other companies in this field, are now discovering biomarkers that can far outperform these sort of predictions, where we have biomarkers that can, on their own, lead to 150x more sensitivity to a particular precision oncology therapeutic. And I think this has the potential to open up new sort of safer and better treatments for oncology going forward. So this is one area on the left-hand side where sort of understanding why we develop certain diseases and what are the unique vulnerabilities that cause those diseases can lead us to develop better and more precise targeted therapies. So that's really focused on being able to read the DNA inside of cells, as well as other things like proteins and RNA, but also be able to manipulate those systems. In the remaining time, I want to talk about now designing therapeutics, right? So we don't want to just take the cell and try to figure out what's going on inside of it. What if we could actually design cells to actually do work for us? What if they could become diagnostics that do things in our body, or can they be better therapies where they can actually hunt out and destroy disease? And so this idea of sort of biological engineering or tinkering is really centered around this idea of building these sort of therapeutics and diagnostics from the bottom up. One of the areas we got very interested, this was about a decade ago, is can we create ways of looking at what's going on inside of our body? One of the big black boxes in the human body is what's happening in our gut. We eat every day, the gut affects our body, but we actually don't have really good ways of seeing what's going on inside. What are the ways we have today, right? What we can do is we can stick a camera inside, right? One way or the other, we stick a camera and see what's going on. We can collect stool and see what's going on there. Or we can take pictures, imaging to see what's going on. But that doesn't necessarily tell us really the intricate biology that's happening there. It turns out in our gut, there are a large trillions and trillions of bacteria that are actually living inside of us, and they're very important for our gut health. And so one of the ideas we had early on was, could we actually engineer bacteria, probiotic bacteria, or bacteria that are naturally living in the gut to be able to give us a better insight into what's happening inside of our bodies? So this is a very simple idea. What if we could give this guy a little pill, and that pill contains some bacteria. That bacteria goes inside, it goes in one end, it goes out the other. But while it's going through that process, we've engineered that bacteria so it actually tells us something about what's happening inside of the gut. What I'm going to show you is actually we've been able to do this now with our colleagues at MIT. where we've engineered these bacteria to sense things like inflammation or bleeding, and also allow these bacteria to actually transmit that information wirelessly by working together with some microelectronic systems to your cell phone or to your computer. So you can actually monitor in more real time what's actually happening at certain places or certain times in the body. The other way you could use this if you didn't want the electronic system is you could have, and this idea has been around a while, as the bacteria comes out the other end, if we can engineer it so it changes color or produces something that you could detect in your toilet, that could be another diagnostic readout of early signs of disease. So this is an idea we started developing a few years ago, where we wanted to convert a pill into a house for bacteria that could actually detect what's going on. So this is based off an idea already. Right now we already have these pill cameras that you can use for screening for colon cancer, for example. And as you swallow the pill, it basically takes pictures as it goes through your body. But why not take that same format, but now convert it so that some living sensor or bacteria could actually tell you what's going on? So what we did was to take a pill, we modified this, and I'll show you a picture of this later. And we basically made little houses for living cells on it, right? So in this particular prototype, we have 4 little chambers. Each one of those chambers, we could put an engineered bacteria. This is a probiotic bacteria that you can buy off the shelf. And what we did was genetically modify that bacteria to detect some biomarker of disease. And in response to that biomarker, it would produce light. So these bacteria are glowing, basically, if they detect some presence of disease. That light gets picked up by a photo detector on the chip, and then the chip has a wireless transmitter that can submit that to your phone. So this is the first generation prototype. We published this about 4 or 5 years ago. It's actually pretty big, kind of hard to swallow, so it's not the ideal system. It's sort of the size of a horse pill. But basically, a whole set of integrated microelectronics here with the cells inside as well as a membrane on top, so that things could pass in and out, but the bacteria would not escape, and this could transmit information about what's going on in the body. Like I said, it's pretty big, about 1.4 centimeters to 3.8 centimeters long. This is the first generation, but it actually works. So what we did was we engineered bacteria that could detect bleeding, right? So bleeding is one of the early signs of inflammation or gut cancer that you want to try to prevent. So the bacteria were designed to detect the presence of blood, and in response, they could generate light. That light was picked up by the microelectronics and then transmitted to your phone or your computer. So this system works in about 30 minutes. It switches on in the presence of blood, which is this dark red curve here, and it stays off in the absence of that particular signal. We've now subsequently done animal experiments with this. We're primarily using pigs for this sort of model, where in pigs you can sense a similar thing, basically in the presence of blood versus a control, which is in black here. In about 45 to 60 minutes or so, you're able to actually get a detectable signal out of the system. So this is pretty exciting. We were very happy to be able to demonstrate that this works, but there were 2 things that we wanted to further improve upon. One is, can we make the system smaller, right? So it's actually of a form factor that patients could easily swallow, especially patients that might have disease that affects the transit of things through the gut, or maybe they have strictures where they don't have a lot of space in their gut. 2 is, can we show that we can detect more than just blood, right? There's other things you want to measure inside of the body. So this is a paper that came out pretty recently. We're pretty excited about. Number 1, we miniaturized the microelectronics quite a lot, essentially made it a lot shorter. So instead of 1.4 centimeters, this thing has a height of about 8.5 millimeters now. So certainly within the form factor of something that we think is very easily swallowed. We've also engineered a variety of now different sensors that you can put into the bacteria to detect, for example, inflammation or other signals that correlate to disease issues. But the same principle, it's the same general principle. There's a molecular detection step in the middle. The bacteria generate light. That light is then transmitted through the chip to your phone. And we've now demonstrated in our assays that this actually can work. Again, this is a pig model that we did with Giovanni Traverso over at MIT, where essentially what we can do is, and we wanted to be able to do this because we wanted to monitor whether the system is actually working in a live animal. We're basically using this as a readout now for inflammation. So in these healthy pigs, you can induce inflammation inside of the gut through this molecule called tetrathionate, which is TT here. And what you can see is in vivo, you can get responses here in about 35 to 40 minutes, and the responses continue to increase over time. And this is, on the right-hand side, showing essentially the sensitivity of the system, which seems to perform generally quite well. So we're quite excited about this approach. I think it's something that, by using living cells to really go in the body, access places that are hard to access for other systems, and also to detect signals that are relevant to disease, we could use this to give us earlier and more convenient detection of disease before it happens. We could use this to try to understand what's going on inside of our bodies where typically we don't have a great window into those areas. So I think this is an example where cells can be used as diagnostics. In the remaining time, I want to tell you about using synthetic biology to create now therapeutics, right? So can we leverage the fact that we can program DNA and turn these sort of systems now into better drugs? So I'm sure most people here know this. This is not too surprising, but DNA at the core of it is at the heart of how all of our cells work, right? DNA is the fundamental genetic code. It turns into RNA through a process known as transcription, and then that RNA turns into protein. Proteins do a lot of different things inside of the body, right? So this is the general flow of information that happens inside the cell at a very, very high level. What you may not fully appreciate is that actually synthetic biology has been able, and genetic engineering as a field, have been able to use these sort of DNA engineering technologies over time to create more and more different types of drugs. So starting from many, many decades ago, the field of monoclonal antibodies was really developed once we could actually clone and manipulate antibodies and engineer a cell outside of the body to produce these antibodies to treat disease. In the last decade, there's been a step change in additional modalities that we now have available to us to treat disease. We have gene therapies where we can take a virus, engineer that virus, change its sequence, and use the virus to go into a disease cell and fix it. We have what we call CAR T cells. These are living cells where you can take T cells from patients, send them to a factory, genetically modify them, and put them in to try to treat disease. We have RNAi therapies where you take a small piece of RNA, you deliver it into a patient, and you shut down some sort of gene that's causing a problem. And even the examples of the mRNA vaccines, I think, are a core example of where synthetic biology has made a tremendous impact on the field. The ability to rapidly sequence the genome of that virus and then turn around and synthesize and create a sequence-based vaccine for COVID really has been enabled by this underlying DNA sequencing and synthesis trend I mentioned earlier. There's a lot of places we could go with this going forward to try to improve upon the fundamental performance of these cell and gene therapies. So one of the areas that I'm personally very excited about, what we've been working on, is to take the first generation of these products and make them smarter. Right? So right now what we have are basically products that we take from the patient, we modify them, we put them back in, and they basically only attack a single target inside of the body. So here's an example where on the right-hand side here, that thing in blue is let's say it's a CAR T cell that's been genetically modified. We engineer it to have a protein on its surface. This protein in green there is called a CAR receptor. And what it does is it recognizes that little green target present on cancer cells, and it tries to kill cancer cells that express that particular target. There's a couple issues with these sort of products today. One is if you have a single target that you're relying on to tell you the difference between a cancer cell and a healthy cell, if you have a cancer that has more than one target, you're going to miss a lot of the other cancer cells. So maybe I'll kill 90% of the cancer, but I'll miss the rest of the cancer cells and they're going to regrow and cause disease, right? So it's not oftentimes a cure for many of these patients. Number two is on the right-hand side, if that green target is not just found on cancer cells, but it's also found on healthy cells, then I'm going to kill off a lot of the healthy cells at the same time and cause a lot of side effects. So because of these limitations of the current products, only about 5% of the potential targets that are on the surface of cells have actually been used to try to treat diseases like cancer. And I think there's an opportunity to leverage synthetic biology now to increase this opportunity window. So why not look at the rest of the 95%? Can we build cells, therapeutic cells, that actually recognize multiple targets instead? And actually, by doing so, can we get much more precise at recognizing what is a cancer cell and what is a healthy cell? So the example here on the right-hand side is instead of going after a single target, what if we could recognize two different cancer targets? Very simple idea, right? One target might not be enough. Let's recognize two targets and let's kill more of the cancer. So that's the idea in the upper right-hand corner. It's what we call an OR gate, right? Because you're killing anything that expresses target 1 or target 2. At the same time, what if we want to address the issue that none of these targets are clean, that they're also found in healthy tissues? We can also design basically a brake or an inhibitory switch called a NOT gate. That's what I'm showing here in purple. And what that purple receptor does is it recognizes those healthy cells, and it says, don't kill those healthy cells. So we can engineer a product that's going around in the body that says, kill cancer based on this signature, but don't kill healthy cells based on another signature. And this sort of capability is very hard to put into a chemical drug or an antibody drug, but it's something that cells do naturally. Our cells in our body are naturally doing this sort of sense and respond behavior. And using the tools of synthetic biology, we can actually program this into living systems. So the way we do this is by engineering a variety of different, what we call genetic circuits. These are different switches, logic gates, computing circuits, all based on DNA that we can put into living cells. Without going into too much detail on the sort of the technicalities of how this works, essentially what we do is we design these genetic circuits on a computer. We create large libraries of these genetic circuits, so we might make tens of thousands or hundreds of thousands of these at a single time. And then we look at which one of these are working the best. We collect data on that, and then we go about and redesign the system again. Right? So this idea of design, build, test, learn, as I showed you earlier, allows us to improve this programming capability. And we have 4 different types of genetic circuits here at a high level. One is called logic gating, which allows us to build those sort of switches I told you earlier. The second one is called multi-arming, so we can engineer a single cell to attack multiple disease mechanisms at the same time. The third is a dial, so just like you can dial up or dial down the volume on your phone, what if we could dial up or dial down the activity of these cells in humans? And number 4 is what we call sensors. Can we engineer cell and gene therapies to only turn on at a certain place at a certain time inside of the body? The exciting thing about this technology is it's like a platform. You can use this for any cell you want, right? These different types of genetic circuits, they're just DNA. And depending on what cell you put it into, you're going to give a different function. So you can put these into NK cells, natural killer cells is a certain type of cell in the body. You can put these into T cells. You can put these into gene therapies. You can put these into stem cells. Sort of the opportunity space for this genetic programming is quite broad. At Senti, specifically, we are focused on NK cells right now, and I'll show you some examples of that. But we have also been able to advance these sort of technologies together with our partners, Spark, which is a part of Roche, and Blue Rock, which is part of Bayer. So let me give you one example of this just to show you a picture of how this is working, right? So I know there's a lot of technical detail in terms of this sort of technology, but let me show you about why we think this is going to be impactful for the treatment of cancer. So this is one of our products. This is a cell that we're manufacturing, right, in our factory, and it has 4 different elements that we're putting in. So again, one of the cool things about synthetic biology is we can program multiple functions into the ultimate therapeutic product, right? So we don't have to rely on a single thing. We can put 4 things into this. So what 4 things do we have here? The first one is we have, like I said, that CAR receptor that activates when it encounters a cancer target and kills those cancer cells. So that's what I'm showing you in green. It's, again, the gas for this cell therapy. What it does is it recognizes a target called CEA. CEA is a target that's found on a lot of colorectal cancer cells. Number 2 is what we're showing you here in purple, right? So if I want to go treat colon cancer, I want to make sure I don't kill off the lung. I don't want to make sure I don't kill off the healthy colon. So I want to protect those healthy cells from being killed. So we have the element number 2 here, which is in purple, which recognizes those healthy cells and protects them from being killed. And finally, there's these other elements here that basically increase the activity of the product. Let me just show you a picture of this. I think pictures or videos of this will essentially illustrate why we think this is very exciting. So this is a microscope experiment where we have basically monitoring these products over 7 days. We have a mixture of cancer cells and healthy cells. The cancer cells are in red, the healthy cells are in green, and they're all right next to each other, okay? So what we want to do is kill the cancer cells and not kill the healthy cells, obviously. Without any treatment, you can see basically both these populations just keep on growing. In the middle here, if we simply engineer a cell therapy that goes after CEA, so a single target, that target is found both on the cancer cells and the healthy cells, so both of them die, right? That's good news on one hand because we're killing the cancer, but on the other hand, we're going to kill off a lot of the healthy cells. With this logic gate, which I'm showing you on the right, we're going to kill off any cell that expresses the cancer target, CEA, but not the healthy target, which is VSIG2 in this case. And what you can see pretty clearly from this video is even though I start off with about 50-50 of that population of healthy cells and cancer cells, we've now programmed our cell therapy to only kill those cancer cells, and the healthy cells are able to flourish and grow. So I know I'm running up against time. We have shown that this actually works in a variety of now animal models. This is being advanced now into human clinical studies. But we're very excited about the ability to use this to drive much better and more potent therapies for the treatment of cancer, along with the ability to protect healthy cells from being killed. So hopefully what I've shared with you today is that there's a whole range of new biotechnologies that are being developed in the field. The fundamental basis of many of these technologies are improvements in our ability to read DNA and write DNA, collect large amounts of data, and then process that data to understand what biology is doing. I think the last decade has been amazing in terms of the advancements and the proof of concept and the demonstration of these technologies. But we are in an inflection point where we know that the world needs these sort of new technologies. There's a convergence of the technology readiness, but also the computing power to understand all this information. And so I'll just leave you at this. It's a very exciting time to be in the field, to be able to increasingly understand and manipulate biology. And I'm very happy that there's a large conference here that's interested in these sort of approaches. Hopefully this is going to be one of the major themes and drivers of progress in this century. So with that, thank you very much, and I appreciate the time.
Thank you very much, Professor Lu. We'll now move on to another round of parallel sessions in the halls to the left and the right of this main hall. The session in the conference hall 2 will focus on the data and AI, accelerating biotechnology's potential, while in the conference hall 3, the panel will discuss how to unleash the potential of genetic medicine. After the parallel sessions, we'll reconvene in this hall for a presentation of the panel on how to bridge borders, Serbia's biotechnology footprint. In parallel, in the Green District, you can attend presentation of Professor Robert Walcott's book and the panel on the role of science and innovation in sustainable agriculture, environment, and energy. Once again, please be aware that beside the panel halls, you can also listen to the panels in the main conference hall by using provided headsets. Thank you very much. odlično. Ladies and gentlemen, I invite you to join us at the main hall for the panel discussion on how to bridge borders, Serbia's biotechnology footprint. Biotechnology will define our future, and we'll now hear how Serbia is preparing for this future. Professor Robert Volkot from Northwestern and University of Chicago, co-founder and chair of World Innovation Network, will moderate this discussion. Welcome, Professor. Also, Professor Volkot, he's on stage, but there is also our distinguished panelists, Professor Zoran Obradovic, distinguished professor and the Center Director at Temple University, US, Dr. Natasha Skoko, Head of Biotech Development Unit at International Center for Genetic Engineering and Biotechnology, Italy, Dr. Stasha Stankovic, Strategy Consultant in Genomics for Drug Discovery at AstraZeneca, UK, Professor Vladimir Brusic, Professor in Computer Science at University of Nottingham in Ningbo, China, and Dr. Vladimir Zmiljanovic, Chairman and CEO of Swiss Rockets, Switzerland. Welcome.
Thank you. Thank you, Vladimir, and thank you to the World Economic Forum and to Serbia. So, before we launch into this conversation that I'm very excited about, a couple of contextual points. First of all, I am not personally an expert in biotechnology. My focus is innovation, strategy, and management at large enterprises, governments, or also entrepreneurs. But I'm keenly interested in this industry of biotechnology, and so I'm excited to speak with the experts on stage. The other point of context is I'm the only non-Serbian. But what has happened here is I met a couple of your Serbian colleagues and they sucked me in. And I came to this last year and I said, this is something exciting is going on here. So I'm very pleased to be back. I've been sucked into the Serbian orbit and it's a wonderful orbit. So with that, what I'd like to do with each of our panelists is ask them briefly, in a sentence, to explain what their realm of this biotech universe is, and then to share one thing that they're most excited about, that they've seen in the industry, in the space, in the science, anything that they've seen recently that they're most excited about for the future. And why don't we start all the way down at the other end with Vladimir.
Thank you very much for your introduction, and very happy to see you all today here with a lot of interesting people, a lot of drug discovery experts, scientists. By background, I'm a medicinal chemist. I grew up in Serbia, and as I was 20, I moved to Switzerland and I did my whole education. Today, I'm CEO of Swiss Rockets Company, which is an incubator and accelerator of Swiss startup companies. But we also made a few years ago a subsidiary company, Swiss Rockets Serbia, and we are now copying and paste the same biotech space here in Belgrade and also in a few other cities as well. What we are doing, we are developing oncology startups and also infectiology startups. We are developing the next generation vaccines, also the targeted cancer therapies, as well as new cancer therapies based on nuclear medicine. And what is exciting me mostly is not only the science and developing new innovative drugs, but also doing something important for Serbia. We have a big plan to build Theranostic Innovation Center. The agreement with our government has been signed, and Theranostic Innovation Center is the next generation of hospitals having manufacturing facility on one side, diagnostic and imaging, but as well the hospital, everything in one building, where in a near future cancer patients will come, they will be screened in a very fast period of time, in seconds actually. You will produce a personalized cancer drug, and what we would like to do is to be the pioneer in personalized cancer treatment, but in Serbia, putting Serbia to the international biotech map.
And I dare say, Vladimir, when that happens, you're going to have a lot of medical tourists visiting Serbia for that kind of a service.
They will definitely get a very good therapy, but also good food and good positive energy.
Well, everyone knows that's good for treating any disease. Professor Obradovic, by the way, the professor shared with me at Temple University, he's known as Dr. Z. So Dr. Z, tell us what's, oh, I'm sorry. You guys sat in the wrong chairs. Vladimir, Professor Brusic, please, what's exciting to you?
I'm sorry for our little trick. Apology. So I'm Belgrade, born Belgrade, educated mechanical engineer. Perfect for talking about genomics, right? I also have multidisciplinary training. Studied at Center for Multidisciplinary Studies here in Belgrade, got masters, and left Serbia, Yugoslavia. It was back in 1987. Went to Australia, and since then I'm going around the world. I continued studies there, and this basic knowledge that I got here was very useful. I could apply it in different fields because the basis was very strong, scientific, and people that I worked with that liked it. So I ended up working in genomics, vaccine development, and I worked in Singapore, Melbourne, University of Melbourne, Singapore National University, Harvard University. Now I'm in China because once when you leave your home, every place is your home. I keep coming here regularly, and I have been in touch supporting my country and my city of birth ever since. And here I am.
In your travels, Professor, what's one thing that's most exciting to you these days?
What I have done is I was using machine learning back in 1990s, artificial intelligence, and that it was not really named like this. And I used this to develop vaccine targets. I used artificial neural networks to do classification of peptides that can be put in vaccines. And I'm very happy that we contributed basic knowledge towards making coronavirus vaccines very fast.
Wow, exciting. Stasha, tell us about...
It's not a wrong chair.
No, you're in the right chair, so you get extra points for class. You're with AstraZeneca, Cambridge. What's most exciting to you these days?
Well, firstly, it's a great pleasure to be here. We were discussing before how often we come to Serbia. I think there is a huge difference in the pattern. Like 5 years ago, I was here maybe once a year. Now it's like every month, every second month. So there is definitely something good going on. So yeah, very pleased to be here. In terms of my background, I was educated at the University of Oxford and University of Cambridge in genomic medicine. And I use now the power of genomics to transform the way we perform drug discovery. So I'm currently based at AstraZeneca, where I develop strategies on how we can make drug discovery process more efficient, more safe. How do we kind of go from the problem to the drug of interest in the shortest time frame possible. And to do that, I use human genetics data from large-scale population studies, like the one that you're currently trying to develop, and really kind of focusing on human as a relevant model and relevant biology for drug discovery so that we don't end up in a situation of having 9 out of 10 drugs failing just because we were studying them and identifying them in the role model. And I think what excites me the most about that whole process is how do we bridge the gap between data that we are collecting and generating with artificial intelligence and machine learning to help us spot the patterns that are not really obvious to us in that drug discovery process.
And we're going to come back to that after our other two panelists present this issue of AI, machine learning, data, and the whole field about, because it's on the knee of a curve right now, and everybody in the world is trying to figure out what to do about it. So if Serbia can get ahead of that, That's going to be an extraordinary advantage. So, all right, now we're to Dr. Z.
Yes, yes.
And they really did swap chairs just to screw me up.
Sorry about that.
They wore the same color
Is this working?
jacket, too.
Can you hear me? Is this working? Yeah. You can hear me?
Yeah.
Oh, yeah, I have to come close. Yeah, I come from Philadelphia, so Temple University. I'm another undecided major person here. So I'm professor in computer science and also in statistics in a school of business. Collaborate in medical school. I'm director of data analytics and biomedical informatics center here. And I do all the things that I mentioned here, artificial intelligence and machine learning. So most exciting thing to me is so what I did long time back for my PhD. Nowadays they call it deep learning, and we just had a different name. Nowadays they talk about big data. We called it large scale, but that's what I do.
Great. Well, we're going to come back to that in a moment. So, Natasha, tell us about what you're up to.
Okay, so as I was born as molecular biologist here at the Institute for Molecular Genetic and Genetic Engineering, and then moved to the International Center. Of course, I'm excited about genetic engineering and biotechnology, and I was sucked into the biotechnology more or less 25 years ago. And I have to say that I'm still excited about the field, about biopharmaceuticals, biologicals, and they are really the best bet of the decade, because biopharmaceuticals, biological drug, is the fastest growing part of the pharma company today. So I'm still excited about that.
What's one thing you see coming in the near medium term that, for non-experts in the room, we should be paying attention to?
When we talk about biological drugs, so
yes.
Just for an audience who doesn't know, so biological drugs are the drugs produced in the living organisms. So let's say that immunotherapy, we heard this morning a lot about that, monoclonal antibodies, so that is a targeted biological therapy. It's something that, it's going on last 20 years, but it's not, it's far away of being finished, because we have more and more monoclonal antibodies coming to the stage, but also more and more coming off of patent. So I think we can touch.
Right. So conquering biosimilars is a big opportunity for Serbia.
Yeah. So definitely that is something that is now the big reflectors are in that field are like when the patent expire for all these very efficient, revolutionary drugs to treat cancer, autoimmune diseases, and many others, it's the opportunity to produce them as biosimilars. That means the copy of the original drug, but for the why it's important? Because of the cost reduction.
Yeah.
So this is something that we should think in terms of saving in the health system in any country. Even in the United States, there are huge savings due to the launch of biosimilars. But also, to the country like Serbia, that would be a great saving for a health system, and also more available drug for the patients.
And the other thing, and then we'll come back to the ML, AI, all that data, et cetera. But the other thing that's exciting about that for me as a business professor is there are so many things that you know. You can say, these are the drugs, they're coming off patent, here's what we know about them. You can build a plan, and you can say, here are the things we need to be in that space, and you can execute against the plan. Whereas what a lot of us do in the biotech space is we think this is going to work, and then 15 years later we find out. So that's very exciting, a very exciting
This is
angle.
very predictable model.
Yeah, very exciting.
We try it really it is like biosimilars now came to age. Last 17, 20 years, they are here.
Great. So let's shift back to data and the biotech space. What are some things we need to be acting on now, we need to be tackling so that Serbia can be ahead of this curve? Who'd like to why don't you start, Stasha?
Oh, sure.
Yeah.
Sure.
You had some very specific perspectives about that earlier.
I think what we were discussing really was that right now we don't really have a problem about data generation, right? You have amazing national biobanks across the world where we generate genomics, but also multi-omics data on many, many people. But the problem that we have now is how do we translate all that knowledge into actions? How do we go from science and good research to business opportunities, for example, in drug development? And this is where artificial intelligence and machine learning can really help with, because if these data exist in isolation from each other, we don't know how they communicate and whether they provide us with orthogonal evidence, meaning that are they pointing us towards the same answer that can help us to produce good drugs, safe drugs for a precise group of patients. So I think where we're heading now is not only to focus kind of on data generation, but also bridging the gap between machine learning and AI to help and boost spot the patterns that are happening in the data that we have. And what we are doing at AstraZeneca at the moment, we are building different pipelines that basically combine all the tools that we develop in isolation from each other, tools that can address druggability potential, tools that can address is this cohort of patient a right cohort for my drug of interest? And then we run all these analyses in parallel to see whether they're driving us to the same answer and therefore boost and cut the time that we need for the development. So it's, as I said, it's more about going from isolation towards orthogonal way of approaching data that we have at the moment.
Great. Dr. Z, it sounds like looks like you have something to say.
Yeah, I come from AI and machine learning, and I'm excited about all of that hype there. There's a bit too much of hype, perhaps, and we have to be careful about that.
Yeah.
So where I come from, they say everything is better with bacon.
Everything's better with bacon?
With bacon, yeah.
Oh.
So tastes better, right? Yeah. So this is actually how many out there in industry treat AI. So let's hire a few more people from my lab. They keep calling me all day long. Yeah, Zoran, do you have a postdoc who is ready, or PhD student? Yeah, even if it's not ready yet, we need that. Yeah, problem solved, right? Yeah, but it's far from that, right? Yeah. So we have to be careful. We have to identify right problems for AI. Yeah. This is not easy. Yeah. So, and some people hope too much out of that. Yeah. There are many challenges, and I'm happy to talk about it.
Although, I mean, maybe you agree or disagree, but there's a lot of hype right now, but I see so much evidence. That always happens, and it'll die down a bit. But I see so much evidence that it's going to be even more powerful in the longer run than most people imagine today. Is that accurate?
I believe so.
Yeah.
But,
so who
but
else
we have to learn from the data, right? Especially because we're in a field that is so sensitive in terms of ethics and you know what's right or wrong. So we got to do stuff to learn from them and kind of have that loop model.
Professor Brusic?
So currently we are doing this science chaotically. So we are collecting data, everybody is doing their own things, there are no standards, so studies between each other are not comparable. So we cannot develop artificial intelligence solutions when data are in different formats. This is like translating from 10 different languages, mixed text into one language. And we know that we'll get nothing. The same principle with computer science, garbage in, garbage out. So what we need to do is we need to basically get the standards or organize studies in the way that they're comparable and start collecting these data. This is probably an opportunity for Serbia because this is open gap in there and we have very strong IT settings here.
Yeah. Anybody else like to add something to that? Yeah, Vladimir?
So yeah, we are speaking now about AI. That's fantastic. That's future. But I would like to give another perspective. I think for Serbia it's important that we build the infrastructure first, that we improve the current academic centers, universities, the labs, that we invest there, and then to have a bridge, to make a product out of academic science. That's why Bio4 I like very much as a project, because that's where the translation is happening from science to a product and then application to human patients. So that type of incubators like Bio4, this is going to give us big bioeconomy factor. That's where actually you will be able to make innovative product, to test them, and then to manufacture them, and if in a case of a drug, the clinical trials are successful, then you can really make big cash for your country, for the company, for academic centers, and so on. We do that in Switzerland. We already proved that in Switzerland with Swiss Rockets as incubate and accelerator startup companies. And we are working very closely together with academic centers, but also with big pharma partners. Just imagine, bioeconomy in Switzerland is giving 40% of profits of this country every year, coming mostly from Roche, Novartis, but also from biotech companies. 40% of whole profits as a country. So that's my wish also to build for Serbia, as we have brilliant minds here, we have excellent scientists, medical doctors, very smart people. Many people I know are planning to come back to Serbia and boost that innovation here. So I see this as priority. And then when we have this and infrastructure, then we can connect the AI specialists, the IT specialists that you already have in this country. And then we could also really be the innovator leader.
So Natasha's got something to add to this, but Vlad, a challenge for you, an opportunity. How much of that Swiss money do you think you can get us here in Serbia?
We already started. We have few research groups here working with us together with a few hundred thousands, but we are planning beginning of the next year to invest millions, as we are planning to put at least 3 companies doing very important clinical trials. So
great. It's starting.
It's already started, yes.
Natasha, what's your perspective?
So, yeah, I just wanted to add one thing that we should not forget. Talking about collecting data, including researchers, academic center, technology transfer, we should not forget to include regulators. And this is from this beginning, because the regulators for all this new technology, they are like crucial. We have to speak the same language. So I will tell you just one example. We had the meetings in Italy with the companies that put the bacteria in the air filters, and they said, okay, we have it. They're really perfectly working. You know, you just put the bunch of the bacteria in the filter, the filter area, it's great, you can put it everywhere. But unfortunately in Italy, I mean, no one wants it from the regulators, cannot understand. They don't know where and how to regulate it. So, and I imagine that problem will come more often when it comes to synthetic biology, artificial intelligence data. We can see now there is a first drug in the clinical trial too, made completely by artificial intelligence. It's reality. It's today. I mean, we can be scared of this or not, but it works. It was the Hong Kong-based company who really designed from the beginning, designing the target, was identifying the target through the artificial intelligence, and making a drug was everything based on the artificial intelligence. So I just wanted to say that from the beginning, we should think also how to include the regulators and educate them.
Yeah, and actually part of the solution is what we're doing right here, to bring experts, business leaders, investors, scientists all together with policymakers to have these conversations. And this can't be the last time this happens. It's going to have to happen more often. So actually, that's where I'd like to go next. What are the biggest opportunities, in addition to some that have already been mentioned, for Serbia to focus and build significant presence in the biotech future? Who'd like to start? Yeah.
Yeah, so Serbia is a relatively small country, so it would be very important to build strength in a focused way. If there's infinite money, it's very easy to move forward. You just invest lots of money everywhere, but that's not the situation here. So it's important to show to the world that this is what we do really well, whatever that is. So this is a big field, this is a team sport. So you need actually a team that plays with the world players, right? And that's where I would start, So whatever, somebody shuts me. Whatever money is there, should be focused to very few specifics initially and then grow larger,
So what's one bet you would suggest policymakers make for Serbia? What's one bet you think Serbia should focus on?
So I'm at university, so when we want to actually grow, we never try to grow the whole university. Maybe Harvard can do that, They have big endowment, But the rest of us, we decide this is our priority, so we want to be good there. So we actually hire somebody who is already world expert in that, and give that person a lots of support.
Resources, yeah.
Yes.
Great.
So when I started this center, they gave me 10 positions so that I hired the whole from the ground level, not overnight, So that has to be done carefully, And then a couple of years later, so they think they changed this mental map of where are these places that they do that stuff,
Right.
And then you grow from there.
Professor Brusic, in preparation, we were talking a little bit about this university space, and you had a recommendation for policymakers here in Serbia.
Yeah, I have a recommendation about, I want Serbia to become a data processing, management, and analysis powerhouse. And this necessarily has to be linked to universities, and people have to be motivated to go for this work. Infrastructure is already there. People are educated on the basic level. And then what is needed to be achieved is that we can analyze complex data sets like it is in biology and medicine. We had those talks today, earlier, that explained how difficult it is, and also some solutions that can be done. Imagine if it can be done on a larger scale rather than on a single company. And also it's very important that this data analysis and use is ethically and legally correct. Again, this was talked about that, so we have all the elements so that this country can move forward in that direction.
Great. Great. Who else has something? Actually, I'm going to ask everybody to have a policy recommendation because this is your opportunity.
So I have a very clear vision how this policy should look like. So the government would need to support first the academic centers where the innovation is happening, to invest a lot in leading universities, in big cities but also in small cities. First step. Second step would be to build Bio4 fast and to establish the, as we call it in Switzerland, biotech ecosystem, to have plenty of small biotech companies, but to have them also together with big pharma companies, with, if possible, hospitals, so to have the whole biotech ecosystem. And that's what Bio4 actually is doing. So that's very nicely planned. And then you need to work all together with centers, academic centers. When they have an innovation, they have to patent protect that innovation. And then they have to give the license agreement to a biotech or big pharma company. If this company afterwards commercializes the drug, the academic centers, they will profit from revenues. And that's where you have the whole ecosystem, as we call it, bioeconomy. And that is something that can really boost the economy. Switzerland doesn't have agriculture that Serbia has, but it has that type of innovation.
Right.
And the largest number of patents worldwide on an annual basis. And that's the key of their economy.
So you've mapped out all the way from research to translation into market, and that's great. But the challenge that I would pose to all of us here is, and it's related to the challenge the two professors proposed earlier, which is we can't just provide support at the universities and do it the same way we always did. We can't just bring companies in the same way we always did. We've got to do it a new way, a different way, a better way. And the people on stage here have ideas as to how to do that. Many of you have ideas as to how to do that. Natasha, what's piece of advice for policymakers?
So I think I can give the best advice is for what we do for the last 40 years at the ICGB, and that's technology transfer. I know that technology transfer changed in the last 40 years. There are different models. We don't have any more technology transfer offices. We now have different players and so on. But I think that the key is the technology transfer from the academy to the industry, between, different players outside of Serbia, importing the technology from somewhere else, because really technology transfer, if you read all the documents, WHO, United Nations, any development organization, they will tell you that technology transfer is a key component of social political development. So that's what we really like. This is not just on the paper. That's what we at ICG do for the last 40 years. And that is how we really now building this relationship with Serbia as well.
And that's where this stuff starts to matter in the marketplace. That's where it starts to matter to people's lives and their health. Stasha, advice for policymakers.
I think I wanted to steal your your comment. I mean, I also think that the powerhouse is the transfer, but I think in order to do that, we firstly have to have a conversation. So we need to sit in the same room, policymakers, academics, clinicians, and identify the problems that we can all work together on. And I think that will ultimately bring us to the one single competitive advantage that we shouldn't be distracted about. So I think, you know, a lot of the problems that happen in the space of biotechnology is getting distracted of achieving big goals. And those big goals might happen tomorrow, but I think what we should be doing is learning from ecosystems such as British one, for example, University of Cambridge, make sure that positions pharma company like AstraZeneca, the best hospital in Cambridge, and the university literally in 2 square meters. So they can't run away from each other. They have to talk to each other, they have to communicate, and that bridge between research into commercial ideas happens naturally. So I would always be pro-communication and not being distracted about being flashy. Right?
Stasha, you said something when we were preparing that struck me, which is we need bigger goals. We oftentimes will look at what's coming next year, what the thing is we've been doing, and we know how to do that, but there's a much bigger horizon out there. Say something about that, and then I'm going to go to the professor for some more comments. Something with Stasha, and then...
I think it was more about that, you know, bigger goals might sound flashy and sexy, so they will attract more money, but that doesn't necessarily mean that they will be good and valuable for long-term development. So we really have to think about where we want to be in the next 10 years. And even though we don't sound super attractive to investors tomorrow, we know that we are paving the path for a sustainable solution that it's going to bring us somewhere in 5 to 10 years' time. And just a quick comment on that, I think one of the kind of proactive advices is building decision tools. So maybe, you know, building a next cancer drug is going to bring us a lot of money, and we will be recognized out there in the world for, you know, being the ones developing that. But I think where our focus should be at is decision tools that will guide us how to make those successes more often. So maybe investing in decision tools is not attractive in terms of sounding flashy, but it's gonna give us a sustainable and solution that is gonna happen more and more often. So yeah, kind of short versus long term, I guess.
Great. Professor?
So this is about short-term goals every year. People have to be rewarded for that, but this is not all of it. We need to build capacity, and it takes years. So people should be supported also to have longer-term goals that can produce many projects, to have basic infrastructure, and not just in academia, just publish every year in C journal. That's not good enough. So we need to have both. And another thing which is very important is communication. People at university, they solve complex problems using complex means, complex tools. If you want to translate this knowledge into industry, it doesn't work. We need to have simple, reliable, useful thing that can be used, solution that everybody can benefit from that. So our professors and researchers have to learn how to talk to business people who want the properties of the product. And I see that there is lack of that. There are two worlds that have difficulties communicating. So this is something that should be enabled before we can move forward fast.
Great. Vladimir, you have something to add.
I just wanted to add, it's also very important to say what I forgot before. We also need to accelerate our regulation authorities. That's something I realize in Serbia has definitely potential for improvement. For example, in Switzerland or in other Western European countries or in US, if you have a cancer patient or a rare disease patient where there is no treatment, then I would like that Serbian patient gets the experimental drug in its own country. And there I saw a lot of administration, a lot of processes which are actually slowing everything down. So we need to improve regulation processes urgently, so that we can, give experimental drugs not only within the clinical trials, but also in a form of compassionate use.
Great.
That will also improve the whole ecosystem.
So I regret we're coming down to the conclusion of this panel, but I hope it's not the conclusion of our conversations. But I would like to throw a question, a provocation to the panel. They were not prepared for this. I would like each of you to share 2 words that describe how you feel about the future of biotech in Serbia. 2 words, do not explain them. 2 words that describe how you feel about the biotech future for Serbia. And it looks like Natasha wants to start.
Bio4.
Say again?
Bio4.
Bio4. Oh, yes, exactly. There you go. I'm not sure if that's 2 words, but let's go for it. Yes. Dr. Z.
Bright and challenging.
Bright and challenging. Great. Sasha.
Unique and diverse.
Unique and diverse, bright and challenging. Yes.
It will happen, but in an unpredictable way.
And clearly the professor can't count to 2. Yes. Vladimir, last 2 words.
Rockets ignition.
Rockets ignition. That's pretty cool. By the way, this was a pretty exciting panel. One thing I learned that I didn't actually know before, according to Zoran, everything is better with bacon. We learned that. That's really kind of cool. And you know what? As Vladimir said, let's be the pioneer. And this isn't just a conference where we sit around and get some free coffee. We're actually supposed to be here for a purpose. And it's a really big purpose. If you're going to be the pioneer, you've got to be all in. We're going to need the infrastructure. We're going to need all the blocking and tackling and the regulation, bringing the regulators along and all that. But as we do those blocking and tackling essential things, we also have to make sure we have big goals. Have bigger goals. We see where we want to be in a decade, but then we've got to take the steps to get there. We've got to take the steps to get there. And you know where it might be? It might actually be to be a data powerhouse. As an outsider, that's actually kind of credible, because Serbia already has an infrastructure of IT expertise, and now you're building this infrastructure of biotech and life sciences expertise. It's credible. But you know what? In the universities and the entrepreneurs and the young people coming up, they need to be not just educated, but motivated. I heard that from Dr. Brucic. They need to be connected. They need to be supported. And, you know, it's a team sport, as Dr. Z pointed out. This stuff is a team sport. That's why the whole team is here today. And it's only when we start to get that tech transferring that it really starts to matter, where people see stuff of great value coming out of this country and changing people's lives. You know what? If we're going to do it, if we're going to do this thing, well then let's do it. And forgive me if I mispronounce this, Napred Serbio. Napred Serbio. Great. Thank you to the panelists.
Thank you.
Thank you very much. 2 words for Dr. Walcott, expeditive and precise. Thank you very much for this panel. And to be like that, like you see, dear ladies and gentlemen, this is our crew, our staff that prepared stage for next keynote and fireside chat by also, and one more time, by Robert C. Walcott, Professor Walcott, and also for Dr. Reshma Shetty, co-founder of Ginkgo Bioworks from US. Dr. Shetty has been active in the field of synthetic biology for more than 15 years. Forbes magazine named Reshma one of 2008's 8 people inventing the future, and Fast Company named her one of 100 most creative people in businesses in 2011. Dr. Shetty has a BS degree in computer science from the University of Utah and PhD in biological engineering from MIT. She co-founded Ginkgo Bioworks in 2008. One more time, welcome to Professor Robert C. Walcott, and pleased to to announce Dr. Reshma Shetty. Please join me.
Oh, the battery died? No, no. Really? Oh, okay. Well, while I'm getting changed, I have to say I'm quite excited. I'm being amplified right now. Oh, well, I'll just speak loudly. I'm quite excited about the conversation. I've been, it's okay. Oh, there we go. Are we okay now? No? Too, although it is wonderful music. Great. So I have to say I'm excited for this conversation because I've been following Ginkgo Bioworks for some time now, and actually I'm a small share owner, so I hope there's no inside information here that we have to worry about. But I'm excited about this conversation. Ginkgo Bioworks, as you might be aware, is a pioneer in creating the tool set of the future, the capabilities that allows more and more of us to try and make a mark in this field of biotechnology. So, Dr. Shetty, it's very exciting to have a conversation with you. Thanks for being with us in Belgrade.
Yeah, thank you so much for the invitation.
Great. So I have to ask, many people wonder about this. Why Ginkgo? Where did that come from?
Yeah, so the name Ginkgo was figured out by my co-founder, Tom Knight, and he picked, we were named after the ginkgo tree, which many of you may or may not be aware of, but the ginkgo tree is what's called a living fossil. It's the only surviving species from its entire phylum, for any biologists in the audience. Basically, it's a relic of the Jurassic era. The only reason that ginkgo trees have managed to survive to this day is because the oldest ginkgo trees were tended to by Buddhist monks in China. So it's a very hardy tree. It's managed to survive a lot of change in the world, and now if you look around many cities across the globe, you'll find ginkgo trees everywhere. So they managed to flourish despite a lot of adversity.
And they're quite distinctive. And speaking of quite distinctive, there aren't that many biotech companies that bootstrapped as long as you did at the beginning. Tell us a little bit about the origin of Ginkgo Bioworks and what was it like bootstrapping a biotech company?
Yeah, so Ginkgo is about 15 years old.
Right.
We got started in 2008.
You were in junior high at that time, right?
That's right, right now.
Yeah.
So there were 5 of us that started the company. 4 of us were PhD students at MIT together, and then the 5th was my professor, Tom Knight. And yeah, it was an interesting time to be starting a company. For those of you who might remember, basically we started Ginkgo, and about a month later, the fiscal crisis hit, and the world economy sort of took a nosedive. Yeah, but we decided to persist anyway, and so for about 6 years, we bootstrapped the company. No outside investment, just kind of scrounging together the contracts and revenue to keep ourselves going while we built out the technology platform.
Well, glad you did. It's been very exciting, and then you really accelerated at some point. The light bulb went on, and people recognized what you had. About when was that the money started coming in to go big?
Yeah, so we spent those early years basically figuring out what our business model is, or what would be, and we eventually sort of settled on that what we sell is essentially GMOs, engineered organisms, what we call cell programs today. So if you are a company who wants to make biotech products, you can outsource your R&D to us, and we'll help you develop the engineered strain or cell line and bioprocess that accompanies it. But it took us a few years to figure out that business model. But once we did, we started seeing some traction early in the food space in particular. Yeah. And so we were able to raise our first significant outside financing in 2015.
But Dr. Shetty, you're not to minimize it, but you're not just a contract research organization. You're actually something much bigger than that for the future of the industry. Explain that, the foundry and the Amazon Web Services of biotech. Is that an accurate?
That's right. You know, one of the things that we felt very deeply about when we started Ginkgo was that the entire sector of biotechnology was really held back by the tools and the technologies for engineering biology not being good enough, right? You know, biological design space is vast, right? There's a huge number of different sequences of A's, T's, G's, and C's that make up an organism, and searching through that vast biological design space is hard with the tools we had at the time. We wanted to be able to search that design space more exhaustively, more intelligently, and faster and cheaper than anyone could before. So we invested really heavily in software and automation and automated workflows to be able to essentially search that design space, try out many different prototypes, and see which one worked. And so now our platform has come a long way, and so we're able to do things like, you know, offer our customers success-based pricing. So if you want to do this kind of a project with us, we know enough about that kind of project that you only have to pay us if it works, which is pretty unusual. Wow. And for companies that are outsourcing R&D to us to be able to have that kind of certainty.
But what is that? So what does that platform mean for new companies? Well, I suppose they don't have to be young, but by the way, young means anyone under the age of 100. Okay. So what does your platform mean for a team trying to start a biotech company?
Yeah, well, so the way we think about it is in sort of analogy to what happened in the IT sector, right? Once upon a time, every computing company, every technology company used to have their own in-house IT infrastructure. They ran servers, they had networks, and it was a whole pain to manage that, right? And then at some point, cloud computing came about, right? And suddenly, you didn't have to maintain that internal infrastructure. You could outsource it to, you know, Amazon or Google or Microsoft, right? But, and so with that outsourcing of the kind of core underlying technology, you suddenly saw an explosion in the number of technology startups, because all of a sudden the barriers to entry became significantly lower because you don't have to build that infrastructure from scratch.
Right.
We'd like to do the same thing for the biotechnology industry. Lower the barriers of entry, make it faster and cheaper for companies to bring new products to market by outsourcing their biotechnology R&D to Ginkgo.
Oh, that's great. So let's pan back to the field of synthetic biology. So many of the people here, of course, are experts. They might know quite a lot about it, but some might not know that much. Briefly, what is new and different? We've been doing biotechnology arguably for thousands of years, especially since the late 70s, early 80s, the human growth hormone and all that. But what's distinctive about synthetic biology, and how is it relevant to solving huge challenges for humanity?
Yeah, it's a great question. I would say synthetic biology really came about because of a whole set of different technology trends that are all kind of intersecting at the same time. And many of them have been talked about today already, right? The decreasing cost of DNA sequencing, the decreasing cost of DNA synthesis, gene editing technologies so that I can go into a genome and very precisely make a change in that genome, sort of irrespective of the species of the organism. You know, these are all measurement technologies have also come a long way. So mass spectrometry as a measurement technology, along with next-gen sequencing, have also vastly improved our ability to interrogate, you know, what is the DNA, RNA, proteins, and small molecules that are present in a cell. And so any one of these technologies alone might not have made the difference, but the intersection of all of those technology trends all at once in this moment in time has meant that our ability to engineer biology, to engineer cells, has, you know, grown by leaps and bounds relative to what it was, you know, just 10 years ago. It's really quite astonishing. And so synthetic biology is really about leveraging those improving technology trends and using it to be able to design biology. And you can, in fact, design it to spec. So just like you can hire an architecture firm and builders to, you know, build your house, now you can go and design biology to make the products of interest.
So very exciting, but make it tangible for us. What's an example of something that you're seeing that's exciting, that brings some of those threads together?
Yeah. Well, what's fascinating about synthetic biology and biotechnology in general is just the vast variety of products that you get, right? So on one end, you have COVID-19 vaccines, which we wouldn't have without synthetic biology technologies on one end of the spectrum. On the other hand, one of the companies we partner with, Archaea, just released a new perfume that you can go buy on their website, which is a perfume that resurrected the scent of extinct flowers.
It resurrected the scent of what?
Yeah, so we're big Jurassic Park fans, just to be clear, at Ginkgo. And we had this idea for a project a few years ago of, what if you could go and sequence the genome of an extinct plant or flower and then infer from that sequence what fragrance compounds it might have made and then recreate that scent? So this is a part art, part science project, but one of our partner companies, Archaea, has actually now made a perfume available for sale that's based on some of that work.
I have to imagine that some of those extinct flowers had some pretty crazy scents that maybe aren't going into the perfume.
I think they picked one that smells nice.
Great, great. So in this process of growing the company, right in the middle of the maelstrom of all the things that are intersecting and growing at the same time, what's something that surprised you in that process that you didn't see coming that we can learn from?
I'm a technology optimist, but I would say even I was surprised at how fast the technology has moved. There are projects that were just sort of we had just dreamt about when we started Ginkgo, but that now are getting significant funding, whether it's from large companies or startups getting going in a particular area, or even government funding. And so things which were sort of just theoretical paper exercises that you'd kick around over drinks with your fellow scientists and engineers are now a reality. And so that's just been an amazing thing to watch.
It is happening a lot faster. And I don't think people recognize both the good and the bad. In the public sphere, there aren't enough conversations. And a lot of them sort of degrade into these science fiction dystopian conversations. What are the implications and the important things we should be thinking about with respect to biosecurity? Because there are going to be, as you said, a lot of new things coming out of this realm that we can't necessarily predict. How should countries think about biosecurity?
Yeah, it's a great question. Again, if I go back an analogy to the information technology sector, when internet technologies were first being developed, and I know this history a little bit because Tom Knight, one of the Ginkgo co-founders, he was around in the early days of the internet and helped develop the ARPANET, which was the forerunner to the internet. Right? And if you talk to Tom, he talks about how in the early days, they were so focused on getting the technology to work, they never really thought about the security implications of what if every person is networked to every other person in the world. And so because we didn't think about the security implications, we ended up with communication infrastructure that's candidly not very secure. And so we've had to basically patch on and build in security after the fact, right? And so we're kind of always playing catch up on the cybersecurity side as a result. We've come a long way, but we're still playing catch up.
But don't you think we'll always be playing catch up in terms of regulation and security and all that? Because when you get better, somebody else is going to figure out how to thwart it.
So there's a certain amount of truth to what you're saying, but I think there is an opportunity to close the gap significantly and think about biosecurity early on, right? Biotechnology has huge potential, right? It can be a major driver of our economy. That's why we're all here talking about the bioeconomy. And I deeply, deeply believe in that potential. I also deeply believe in biotechnology as a potential path to solving some of the world's most pressing problems, as the minister and others talked about today. But I think it would also be irresponsible of us to not think about, in conjunction with investing in the bioeconomy, to think about investing in the biosecurity measures that keep us safe. And I think all of us can appreciate now that we've been through a global pandemic just what can happen when biology gets out of control, right? That was a small piece of biology that just spread out of control around the world, and it affected every single person on the globe's lives, either economically or from a medical perspective, one way or another, right?
And you're not just talking about this. I think Ginkgo is actively involved in some programs to try and enhance the future biosecurity.
That's right. When the pandemic hit, even though we had never sort of worked in the biosecurity space from a technical perspective before, we really felt like a sort of a call to arms that we need to be part of the global response to the pandemic. And so we invested in building out biosecurity infrastructure, which at the time was very much focused at COVID-19, We wanted to reopen schools in the United States so our kids could go back to school and so that parents would not go crazy. And so we developed a testing program by which we could basically test kids and reduce the spread of COVID-19 in schools. But what we realized as we were building in that infrastructure is that by tweaking it a little bit and changing a little bit, we could actually use it even to for biosecurity purposes to monitor the spread of, say, new variants. So for example, Ginkgo has a partnership with the Center for Disease Control in the United States, where at select airports in the United States, passengers, when they're deplaning from an international flight, they can voluntarily provide a sample, and then we'll go and sequence those samples, test them for COVID, and then sequence them. And so with that program, it's actually kind of astonishing to me because we're testing a very small fraction of the inbound passengers into the United States. But even then, we're able to sometimes detect variants of COVID before they take hold in the population. And so some of the first reports of certain variants have come through that screening program. And so, but the reality is that the threat's not just from human pathogens, right? We also, our livestock, there are potential threats there. Our crops, there are potential threats there. So how do we put in place the monitoring network to be able to see what is spreading among whether it's humans, livestock, or crops, right? It's sort of this One Health theme that a lot of folks are talking about. And I think there's an obligation that if we want to be able to reap all the benefits of the bioeconomy, we need to invest in parallel into the infrastructure to keep everybody safe. And that's what that biosecurity infrastructure, needs to exist.
Related to this, something that no panel would be complete about is at least somebody mentioning artificial intelligence. So how does AI fit within your rubric? What are you seeing change being wrought in your space?
Yeah, it's a great question. And I would say at Ginkgo, we are incredibly excited about the intersection of AI and biology. One of the interesting things about something like ChatGPT, right? ChatGPT is fundamentally generating, human language, right? And so I can read an output from ChatGPT, and it actually has a pretty high bar it needs to hit, right? It needs to make sense to me, a human, and humans, invented human language, and we're pretty good at writing, and so we can actually assess that pretty well. And it had huge amounts of data to be able to train that model on. But in contrast, if you look at biology, humans didn't write DNA code, right? We actually aren't very good at writing it at all right now, even with how far the technologies have come. And so, but yet we have access to huge training sets, right? The genomic data that's available from the various public sequencing projects. Ginkgo have our own internal sequence data that we've generated over the years, either in-house or via acquisitions. So we think there's a huge potential to be able to train large language models, what we call foundation models for biology, to be able to do protein design, to be able to do DNA design, to be able to do ultimately genome design and whatnot. And so we're just at the beginning of that, but I think there's just a tremendous potential to leverage all of the data that has been generated through biological research and use that to develop generative AI tools for designing biology. And then ultimately, those foundation models can be used to develop what we call task-specific models for specific applications, whether it's I want to develop a new enzyme that has better heat stability, or I want to develop a new gene therapy that works in a particular tissue.
Right. So. And of course, you're going to be doing all that work here in Serbia, right?
Well, we certainly are excited to partner with folks here in Serbia to bring about the bioeconomy.
Great. Well, on that point, what's one piece of advice you would give to the leadership, business, government, academia here in Serbia to rise in the biotech future?
So it's a great question. I would say I'll start by saying I've been hugely impressed by all of the folks that I've met here today. The Serbian government has clearly an inspiring vision for what they want to build here in Serbia, and so hats off to the Prime Minister and to the Minister Begovic. It's really tremendous what you want to build here, and so it's quite refreshing to come and have a government official tell you all about the future of biotechnology. I'll be honest, it doesn't often happen. And so they're very much on the right track in my view. Yeah. And what I like particularly about their approach is their like they think about it from a systems perspective, from an ecosystem perspective, right? How do I create the right workforce that is trained in these areas? How do I think about supporting the research community and the academic community in these areas? How do I foster a startup community in these areas? How do I bring in big companies to be part of that ecosystem? Because I think, having the benefit of Ginkgo being in Boston, which is a rich biotech ecosystem in itself, that's really where the strength comes in, is that ability to kind of have this community where you both can learn on a much faster time scale from each other, right? Companies can exchange information, there's flow of people and information.
All right, well, thank you very much. Sorry, keep going.
There's a flow of people and information between those communities, and that's really important when you're talking about a very hard technical, challenge like making the bioeconomy happen.
Yeah.
So that's really impressive. I would say my one piece of advice, and I think this is the one thing that the U.S. does well, and that I think other countries don't always appreciate, is that in the U.S. It's okay to fail, right? So it's funny because if you are a startup founder and your company fails, you're actually more fundable after you have a failed company because they think you've learned your lesson and that you're more likely to be successful the second time around. And I think sometimes in other countries, failure is not always well tolerated or well respected, and that makes it much harder for a young person or even a late stage career person to make the leap. And so to the extent that you can foster a culture where it's okay to fail and you have yet more opportunities in front of you, that can really help.
Okay, it's 10 years from now. Ginkgo Bioworks has just acquired Moderna, and Pfizer is begging you to acquire them. And what's the headline?
Well, I hope the headline is really that right now, the way we make all of our goods is very extraction-based, right? I go dig up oil, I dig up coal, I dig up natural gas, and then I turn that into the products I need, whether it's the carpet on this stage or the paint on the wall or the lights at the top of this room. I would love to see the world transition to a place of abundance, right? Where biology is amazing because it can self-replicate, and it does so using some of the most sustainable inputs you can imagine, right? Sunlight, CO2, carbon dioxide, and whatnot. And so can we move to a world where we grow everything rather than extracting everything? I think that would be a tremendous vision for the future, and that's what I'd love to see happen.
Amazing. So, last question. 3 words to express how you feel about the future of biotechnology, and do not explain them. 3 words to express how you feel about the future of biotechnology. Hyphens are acceptable.
Life on Mars.
Life on Mars. We should talk. We should talk. So you thought she just founded and runs a biotech company. No, her long term is how do we create a place of abundance? Projects we just dreamt about not so long ago are now real, and you're building a platform to allow other people to take their dreams and make them manifest in the world. With the intersections of so many technologies coming together all at once, everything, everywhere, all at once, it's part art and part science. You're enabling everyone to stay foolish, to quote the great Steve Jobs. I have to say that the changes wrought by biotechnology, and this isn't just me, of course, over the rest of our lives will be far more profound than we can today imagine. And part of that will be because of your work, Doctor. Thank you so much.
Thank you very much.
Wonderful.
Thank you very much. Oh, okay, one more time. Yes. Oh, here we are. Thanks again, Professor Walcott. Thank you, Dr. Shetty. Now, as you see, we are changing the stage for other scenery and other thing. We'll now see how the leaders' support manifests itself in concrete actions. The government of the Republic of Serbia and Ginkgo Bioworks, a leading company in cell programming and biosecurity, will sign a memorandum of understanding to advance the bioeconomy vision and enable joint work on advanced solutions in space of pharma, food, agriculture, and chemicals. I'm kindly asking Dr. Jelena Begovic, Minister of Science, Technological Development and Innovation, Republic of Serbia, and Dr. Reshma Shetty, co-founder of Ginkgo Bioworks, to come to the stage to sign the memorandum. Thank you. Yes, the stronger applause. Congratulations. I wish you a fruitful cooperation. Thank you very much, ladies. So, ladies and gentlemen, distinguished guests, we came away from today's Biotech Forum with a clear picture of how this second chapter will unfold. Thank you all for your valuable contribution to today's important discussion. I hope this forum was able to offer new perspectives, innovative ideas and practices. Before we leave, let us see a few snapshots of today's forum. It was a really, really great pleasure to see you all here and here. Dear ladies and gentlemen, I will surely invite you to cocktail in front of main conference hall to chit-chat more, but to address you the final words, I will kindly ask Minister Begovic, please.
This was not really planned. First of all, I want to thank to all of you of being here today and for sharing your knowledge and sharing your experience and participating in our vision for future of Serbia, but also for participating in the vision for better and sustainable future of all humankind. And I'm so happy that I was lucky that in my life I chose molecular genetics and biotech as part of my inner thoughts and career, and that today we are gathering the government, the academia, private sector, civil sector, and financing sector, and that we are all talking about biotech as a solution for the challenges. So thank you for supporting us in our vision for the future of Serbia, and I'm really looking forward to continue collaboration and continue communication and exchange the experience, because I think this ecosystem will create a better future for the world. So thank you one more time. I hope you enjoyed. I hope you made new connections. I hope you got new ideas. I heard some ideas for the first time, and I'm really happy for that and thankful. And now I'm inviting you to switch to a more relaxed, although this was relaxing for me, an informal way to finish this amazing day in Belgrade. Thank you.